I'm going to ask if you wouldn't all mind just coming down to the first few rows. That would be really great because, you know, we had the formal session yesterday. Today is much more informal. We'd like to get some good discussion going, so let's try and make this room slightly more intimate if we can. So Glenn is the back of the room. So everybody needs to be further forward than Glenn, please, in this center section here. That would be great. Glenn's causing trouble at the back, but everybody else is up front. Okay, so we've definitely not got a total of 120 people here today. Okay. I'm going to give everyone a minute or two to just come with the coffee and various things. Glenn's off. Okay, so this session is where we get the chance to basically drill down a little bit into some of the themes that were touched on yesterday. We're going to have two opening presentations. One is from Glenn, who has just left the room. Julie, would you mind just tracking him down? Thank you, that would be great. He did apologize. So Glenn is going to give us an overview of the demand side of weather and climate information for heat. So Glenn is the author of the WHO guide for heatwave early warning system development, so he has a lot of experience on working with decision makers on this issue. The idea is to frame our conversation for the rest of the session to just have in mind how people use the information, what they might be looking for, just so that we can try and focus a little bit on getting some useful outcomes. After Glenn's talk, we're going to have Melissa MacDonald from Environment and Climate Change Canada, and the ECCC, that I know. And Melissa's going to give us an overview of weather forecasts for heat and some of the operational issues that come up and that we'll need to consider. After that, we're going to have 3 rapid-fire case studies showcasing innovative weather and climate products from around the world. So we'll have Natalia Herrera from Argentina. They've launched their early warning system for the first time this year. We'll have Mr. Bhan from IMD talking about the scale-up of the heat early warning system in India across different cities and the things that have come up from that project. And we'll have Cedric Van Meerbeeck, who is coming from the Caribbean Institute of Meteorology and Hydrology, talking about seasonal climate services for heat. Following that, we're going to have a panel discussion in which we will have some opening statements, and we will then have some discussion based on those opening statements and the earlier presentations. Okay, and then we'll have coffee, and then we can talk about what's next. So, I'm going to invite distinguished speaker Glenn McGregor to come down the steps and make his overview presentation. You did.
Sorry, is your PowerPoint?
No, this isn't it. This is understanding risk. So we're in. No.
Because I think they put like the PowerPoint that is in
It's because we switched. Oh, right. Let's just get them here. So yeah, we can use this one.
maybe just to give everybody a couple of guiding questions to be thinking about as we're going through this session, because there's so many different ways this conversation could go. We haven't got that long, and there's so many things that are going to come up. What we're really trying to get at in terms of outcomes from this session is what is working in terms of meeting demand from the health sector, from the humanitarian sector and others. What are the challenges that we're facing? Are there any commonalities in those challenges, and what are the main opportunities? Are there any quick wins that seem to be common among different systems? What are the sort of short and longer term things we should be aiming for? So just bear a few of those overarching questions in mind.
Thanks, Hannah. I'll buy someone a coffee if they can spot the grammatical mistake in the opening slide there. Okay. So I'm going to talk about weather and climate information for heat health management systems, users' perspective. I'm not a user of climate and weather information. I'm an academic, so I'm going to empathize with being a user and imagine I'm a user. So we kind of asked the question, who uses climate and weather information? We got some folk wandering around the streets in Mongkok. Someone's asking, what are the physical drivers of heat waves? Another person is thinking, is it going to be a really hot summer this coming summer? Some mother is asking her child, what's the humidex today? And someone else is saying, oh, is that a heat alert I spot up there on the electronic board? So there's a whole range of people who might be using weather and climate information. This is a graphic from the Global Framework for Climate Services, just looking at the climate knowledge to action chain. On the left-hand side, we have producers, for example. It might be the global producing centres, regional climate centres, so on and so forth. And these are the various levels at which climate information is ingested, digested, and also modified and produced. And all the while, along the bottom, you see partnerships are incredibly important, whether they be research partnerships or development partnerships. And also, there's a role for the private sector in here as well. There's a lot of detail in this slide. I'm not going to explain it, but I've just put it up there to encourage you to think about where you might place yourself as either a producer or consumer or user of information, because that kind of determines, I guess, your behaviour and how you interact with others, and the type of questions you pose and how you frame your problem. So where you place yourself in this wider knowledge to action space is extremely important. Now, everything sounds very rosy. We've got lots of forecast products, information products, and there's potential consumers. But I think we have to be honest. There's a whole range of barriers and constraints to the uptake of information. And those barriers and constraints can exist at a range of levels, right from the micro, the individual level, right up to the macro, the national or government level. Again, I'm not going to read through this, but if you just look at the left-hand column there, drivers of climate information use, right down at the individual level, you can feel that I am at risk. So in the context of heat, you might perceive yourself as at risk to heat. So you're amenable to taking in or consuming or looking at any climate relevant information or weather relevant information. But a possible barrier to climate information use at the micro level, bottom left-hand corner, might be, for example, that you are very skeptical about the use of climate information and how it can make you, help you with your own personal decision-making process. These slides are going to be available on the GIN site, so I'd invite you to look at the detail within here. Now we can conceptualize all those. Top part of the diagram just indicates a free flow potential of a flow of information from knowledge to action. The second panel there indicates what we call the user space, and these factors operating at these micro to macro levels, and how they can constrict or constrain the flow of information from a producer, whoever that producer might be, into the so-called user space. And the bottom panel is one we would all like to be. There's overall reception at the micro to macro level that weather and climate information is of use to us in our particular management problem, and therefore there's a free flow of that information and uptake of that information. So this is kind of just conceptualizing some of those ways in which information can flow through to us. Now, you're going to see a few slides which you saw yesterday. Hannah had this very useful one up showing the interaction between the time scales of climate information, right from the micro scale, minutes, hours, up to the much longer centennial time scale. So again, I've put this up for you to think about where your position is. Which space do I work in? Because that's going to be really determined, if you're a scientist, kind of the nature of the science you do, some of the questions you ask yourself, and if you're a user, you might be somewhere in a different place on this diagram. You need to think about the type of information that you want to get from a producer, and also why you are using that information. So this really helps with your problem definition as a user, understanding that interaction between these scales and actions to take. Hannah also showed this diagram yesterday. We know predictability dies away very, very quickly after the day to 2 day time scales. With the sub-synoptic time scale, we're reasonably good with predictability of weather forecasts, notwithstanding there is seasonal dependence and geographical or spatial dependence. There's a problem in that sub-annual time scale, the monthly through to annual time scale, when predictability is low, seasonal to annual time scale, and then predictability in general is a little better at the longer time scale. So again, an invitation to think about what space you're working in terms of a producer and user, and thinking about some of those predictability problems. Now, of course, predictability is very much determined on the degree to which we understand the physical drivers of a particular climate hazard, or the determinants of a climate risk, setting aside the social determinants as well as physical determinants as well. And this just kind of shows you the cascade of spatial scales at which physical processes can work to determine the likelihood of a climate hazard, the occurrence of a climate hazard, whether it be a tropical cyclone, hurricane, or indeed a heat wave. Yesterday in the panel discussion, I made reference to the second tier there, land surface feedbacks, and I'll speak about that in a moment. But these physical drivers can operate at a range of timescales, and of course they can interact. So at this level here, we've got synoptic wave breaking. These are Rossby wave breakings, which leads to blocking episodes. Blocking is an extremely important process for the generation of extended heat wave events. And of course, one of the great challenges in forecasting is forecasting regime transition, the transition to a blocking situation and the transition out of a blocking situation. So there's various scientific challenges at these various scales, and understanding all the drivers. And of course, right at the local scale, down at the city scale, we can have amplification of some of these large-scale processes. And a good example of that is the role of land surface feedbacks, interaction between a rapidly drying land surface and how that can alter the nature of the surface energy balance. So a lot of the available net radiation or energy goes into heating the atmosphere as opposed to latent heat flux or evaporation, which is a general cooling process. So understanding the role of land and atmosphere interaction is extremely important, especially in the generation of these so-called mega heat waves, some of which we've seen over the last decade. Also, I think as a user and a producer, you've got to locate yourself in terms of the geographical scale you are working at, because that determines kind of the science you do and that determines the kind of product that you create, and also as a user it determines the type of information you want. So right from the global down to the personal, so I've taken the example of this part of the world, world regional, East Asia, nation state, China, so international a national agency might be working at that scale, then down to the regional, down to the administrative region, and in our case Hong Kong, down to the locality, Hong Kong Island, bearing in mind we've got Kowloon and the new territories as well, then down to the neighbourhood scale, we're in the kind of the Sai Ying Pun neighbourhood here, and down to the street level, so we might be down into Pok Fu Lam Road, and then to the individual apartment or household level, and down to the personal level. So the processes operating at these different levels are very different, and therefore the products are going to be very different. So again, if you're a user or a producer, you've got to locate yourself somewhere in this range of geographical scales. We saw this diagram yesterday. We're talking about climate and weather information. This is just an example of how that information might flow through a heat health action plan, emphasizing there's always got to be a lead agency. So this comes back to this whole issue of heat governance, who takes the overall responsibility for a particular climate hazard. And of course, as a climatological or meteorological community, we're often involved in the development of these weather or climate-based alert systems. And of course, this is one way in which a heat health action plan manifests itself. Virginia Murray will be talking later this afternoon about the England heatwave plan, but you can see there's a cascade of information from the Met Office in terms of its forecast to a whole range of users and stakeholders. So this kind of stakeholder and user mapping is extremely important, not only as a producer, but also as a consumer. And if we get right down to the level of the actual weather-based warning system, so this is a heat health warning system as opposed to the action plan. This is the alert system embedded in the wider action plan. Then a lot of us spend our time trying to find out and discover what are the warning criteria. Many of those warning criteria come in the form of a threshold. Shari yesterday talked about this U-shaped relationship between heat, even though we use temperature as a default for heat. Heat is far more complex than temperature. But anyway, that just shows the relationship between heat along the horizontal and mortality, one health outcome up the vertical. And a lot of us spend a lot of time trying to identify that threshold temperature, threshold biometeorological index, which indicates the value beyond which mortality rate rises in terms of heat on the right-hand side, and similarly on the left-hand side for cold. Now we know these threshold temperatures vary widely. This is some work I was involved in many years ago, the European Union funded FUI project. So this is in terms of threshold temperatures for apparent temperature, not Tmax, apparent temperature. And we can see the city to city or geographical variation in these threshold temperatures being much higher than in a warmer climate than a much cooler climate. And of course, as a producer, we might want to produce or generate one of a range of indices. This is a little out of date now, but it just shows you for a number of heat health warning systems across the world, the type of threshold which is used. So there's no one size fits all, as was emphasized yesterday, in terms of the actual thresholds used. And of course, the threshold might not be in the form of a simple weather variable such as temperature, Tmax. It might be in the form of a more complex biometeorological index. There's over 100 biometeorological indices, and this is just a sample of some of the indices that are used both in research and practice. And what I mean by practice, are actively used in heat health warning systems. So if we're a producer, we've got to think about the predictability of many of those input parameters into these calculations of these biometeorological indices. So here's the heat index up the vertical axis, temperature along the horizontal. And this just shows you quite nicely the sensitivity of the heat index to variations in humidity. Now, humidity and dew point is one of the holy grails in terms of forecasting. It's much easier to forecast temperature. Temperature is a lot more predictable than a measure of atmospheric moisture. So if you get atmospheric moisture wrong, you can take your prediction from a not so stressful category into a high heat stress category. So predictability is a huge issue. And of course, we've got to ask ourselves the question, are we interested in a probabilistic forecast or a more deterministic forecast? The two being quite different. And of course, as far as risk communication is concerned, there's a bit of a challenge around the interpretation and understanding of probabilistic forecasts versus deterministic forecasting. A lot of people are more comfortable with the deterministic forecast, which states a definitive value for a forecast occurrence, whether it's going to occur or not, or an absolute value. And of course, that might apply to our threshold temperature. We're going to produce a probabilistic forecast of our threshold temperature or a deterministic forecast. And of course, users worry about the forecast quality attributes, and those are the 6 main attributes of forecast quality. So as producers and consumers, we've got to think about whether the quality of the forecast really suits our needs, and of course, that has a big bearing on the trust in the forecast or the prediction. Quickly, these are some of the challenges for integrating seasonal climate forecasting into user applications. I won't spend a lot of time on this, but essentially there's climate science challenges, the so-called system challenges. So do we understand the system for which we're doing the forecasting for? Do we understand how the health system works, so on and so forth? And there's the broader challenges of feedback between the consumers and the producers. And also there's the big challenge, which is challenge number 5, the overall challenge is, how do I design and implement the system? It's very easy to draw a diagram on a piece of paper and saying this is how it's going to work. But human behaviors, of course, help with this. Here's some specifics, perhaps in terms of heat, things we need to think about, some things that might keep us awake at night as producers and consumers. Developing heat prediction products 3 to 4 weeks in advance, but however, this time scale is problematic. Small signal, large noise, and low predictability. Development of user-friendly interactive tools for heat outlooks, probabilistic outlooks for tercile categories, or outlooks tailored to user risk profile, so on and so forth. I'm aware of time, so I'll let you read those in your own time. And of course, we've got to ask the question, where and how do people want to access climate information? And there's a whole range of ways in which people might want to access climate information or have it produced for them. And of course, cutting across all of these platforms or ways in which people receive information is how we communicate risk. Thank you.
Okay, thank you very much, Glenn, for that overview. We'll move straight on to the next presentation. I think we'll do them in quick succession, and then we'll have plenty of time for some good discussion afterwards. So it's a pleasure to welcome Melissa MacDonald from Environment and Climate Change Canada to talk about issues related to weather forecasting for heat.
All right. Good morning. I'm excited to get into heat forecasting. And a lot of what I'm going to talk about today follows on some of the points that Hannah mentioned yesterday, and Glenn even touched on a few of them. So hopefully I'm under 15 minutes. All right. So we're going to talk about advancing our capabilities and knowing our limitations in heat forecasting. So just a quick overview. We're going to skip that. That saves time. All right, heat forecasting. Now, the most important aspect, I think, that we need to really start and think about is our observations, of course. They're really important. They're what start everything moving on. We have both ground-based methods, satellite-based methods. For the most part, I'm just going to skip to the important details. In ground-based methods, you want to think about your data source and making sure that you use all the networks that you have available to you, even if you're not as trusted observations, I think. But you also have to remember where that observation comes from, and you want to make sure that you're covering all the parameters required, especially when thinking about heat. So not just temperature, we know humidity, but also considerations of wind and our solar radiation. In terms of satellite-based measurements, of course, we have high-resolution radiometers, but there is limits to those observations, that's what's great about them. That it covers areas that are limited in observations, such as sea surface temperature and the Arctic. But there's limitations. We need to have cloud-free conditions, and then there's a trade-off between resolution and frequency of observations. In this top right-hand corner here, I have an example of our MODIS and Landsat. MODIS produces very high-resolution observations, but only occurs every 15 days, whereas Landsat, we get less resolution. However, it occurs every hour. So there's trade-offs. Of course, local effects, I think we're probably all quite familiar with a lot of these. The urban versus rural environment is very important. We heard a lot about urban heat island yesterday, but also population distribution. And I think I want to touch on climatology again. Yesterday I mentioned about the use of our normals period in terms of consideration for climatology and seasonal forecasting. And this is now becoming quite out of date. And also within climate change, I'm not sure anymore, my opinion, if that 30-year period is really as reliable as it used to be. Heat indices. Thank you, Glenn. Great overview. I don't even think I need to go there right now, so I'm going to skip it in terms of time. When developing a threshold, we really want to consider a lot of different aspects. Of course, the epidemiology and health evidence is very important, but I mentioned yesterday, warning fatigue is a really important aspect that we consider. If we overwarn the population, they start to tune out. So I'm talking really about the public here. And then, of course, how do you operationalize that threshold? There's a big balance between your forecasting resources and capabilities along with any requirements of your partner. And how do you make that work? And then the type of threshold and how you develop it. We already heard from Glenn how many variations of thresholds can be developed or criteria for heat alerts and heat indexes. There's lots of different considerations. Is it going to be a temperature or index-based or a combination? What we've done in Canada is actually a combination or an either-or. And are you going to consider an overnight component so that you're thinking of no relief from heat? I know humidity falls in that category, but we just heard temperature is a better predictor, or more our best predictor. And therefore, considering a maximum and minimum temperature combination is also sort of incorporating humidity. There's a little bit of less precision with that minimum temperature, considering it is affected by humidity, but maybe it's a better predictor. Is there a duration consideration into the threshold? Are we talking about consecutive days, or is it a single extreme heat event? And then, of course, a tiered system. I think that we've already all decided that tiered systems are important, especially for your action and response. But how does it vary based on the population or vulnerability groups? And are we going to consider possibly an early season criteria as compared to a late season in the regions that have more seasonality? And so now I'm going to get into scale a bit. I realize now I should have made it a PowerPoint because my little images don't come up in the same way, but that's okay. So in particular, spatial scale, and I hear Glenn talk about the idea of our different levels of forecasting almost, but this is a different concept here. I'm going to talk a little bit about the area of coverage versus the resource availability, and I think I already kind of hit on this yesterday when talking about Canada in terms of 12 forecasters for quite a huge area. But I'm going to talk about it a little bit differently now. So here we are in Canada, and I'm going to zoom in to the maritime region of Canada where I'm from, and then look at the province of Prince Edward Island, this little red spot right here. And then here we have Prince Edward Island kind of zoomed up, and you can see each of those black dots on there are our observation stations that we have available currently. So just for a little bit of context, Prince Edward Island has a population of 150,000 people. It has an extremely low population density in terms of Hong Kong, for sure. It's 5,200 square kilometers and only 8 observation stations. Let's contrast to Hong Kong. I pulled this from Google, I'll be honest. Hong Kong is half the size of Prince Edward Island and has 7.6 million people and has over 30 or more observation stations that I can count. So there's a relative difference here in terms of what you're taking in and what you have available to you. I have a picture of UK, 210,000 square kilometers, 130 or more observations. I have an image here of Canada. We have 10 million square kilometers and only 1,200 active observation stations. It's difficult. Funding is difficult. How do you get travel for maintenance? How do you maintain that network? And then, of course, the effects related to how is brought into your network, but also your forecast production, as I mentioned yesterday. And then thinking more of the temporal scale, we have the day 1 versus the day 2 forecast, and there's a lot more certainty with your day 1 forecast than there is with your day 2. I'm not saying there's not certainty with day 2, but how do you explain that in terms of your forecast? How do you get that message out? And how does that operate in terms of early notification to your health partners versus the uncertainty? How do you balance that, and what do your partners want to know? And then, of course, the idea of duration of the event versus this extreme single-day event. Forecast models. Glenn touched on deterministic and probabilistic, so I think I got this covered, but I'll just do a little brief information here. The initial conditions plus the exact physics is supposed to create an accurate forecast. Supposed to, right? That's what a forecaster wants to create. Forecasters are extremely analytical people. They want a yes or no answer. They are set on producing a perfect forecast. But there's a lot of error and uncertainty associated with that forecast of a deterministic model, of any model for that matter. The initial conditions, I already talked about the issues that we have surrounding observations. But then on top of that, the initialization of the models, so how are those observations put down to that grid level, or in those grid points, and how much interpolation has to happen between each of what we already have in terms of observation, and then just the assimilation of that first 6 hours in the model. Not to mention the model error for itself. Do we really think we know all the answers about atmosphere at this point in time? I'd like to think we do, but I don't think that's likely. Not to mention the amount of estimation we take into account within our equations. So that leads to our probabilistic forecast, or at least that's the way I see it. It's a lot better in some ways to be able to show the various solutions and weight them for a probability forecast. And we need to learn how to weigh those probabilities correctly. I have a few examples here. This is trap map from one of the hurricanes. I can't even recall which one at this point in time. Apologies. But the warm sector of, say, pretend this is a low pressure system. Where does the warm sector sit on that low pressure system? How is the heat flowing in front of it? And I use the example of the Atlantic coast because if you reach up here, this is where I'm from in Halifax, Nova Scotia, Canada. And for us, this is a really big deal. If the track moves towards inland, just to the west of us, we're now in the warm sector. If it moves to the east of us, out to the ocean, we're now in the cold side. And I know it's not necessarily as applicable exactly with temperature. It does work, but we're not usually seeing it this way with heat waves. But it's very applicable, for example, the difference between snow or rain. So it does have quite a variance. And it's good to be able to see how those probabilities weigh out. And then just a couple of other examples there. So this leads to the Ensemble prediction system. It's meant to simulate the inherent uncertainties in weather models. Of course, with that, resolution is decreased because you have to balance the amount of computational needs and time it takes to compute that and have it ready for a forecast. There's multiple runs of the model done. And you can use this as a bit of a determination of whether or not you think your deterministic solution may be reliable. A smaller spread means that things are agreeing, therefore your deterministic solution is much more reliable. However, a larger spread means that it's probably less reliable. And there's various ways to develop an ensemble prediction system, but the general ideas are different versions of the same model, or different versions of the initial condition, or a combination thereof. This is an example of a product that's produced, and this is from Halifax, Nova Scotia, through our North American Ensemble prediction system. This is a joint venture between the US, Canada, and Mexico to develop histograms for the most part. I mean, you can develop many other things, but I use the histograms the most likely to display the temperature, and it shows you how, with time, the probability or the uncertainty of the forecast does come into effect. But I really like the way I can look at the probability of the temperature. So just a little brief overview of some of the other modeling advances that we have. Most of these do come from my area, in particular within Canada. So of course there's developments in high resolution modeling of the urban heat island effect, and this is really beneficial for some urban planning processes. There's some work being done by our research side, research modeling, and working with the province of Quebec and the city of Montreal to try and look at how they should green the city and the canopy. We also did some work for the 2015 Pan Am Games to try and model some thermal comfort indices. Humidex, wind chill, UTCI, Universal Thermal Climate Index, and the wet bulb globe temperature were all modeled. Humidex, for those that don't know, is the Canadian version of the heat index, I guess you could say. It's a temperature humidity index. And then we evaluated that down here on the right-hand side against our denser Pan Am Games MetaNet. I already talked about how we don't have a lot of observations, but we did create a much more dense network for the games in order to be able to forecast and provide information to the sports. And then the last product here I have is the heat risk product. This has been developed in the southwestern US, and it's meant to identify potential heat risk. It's experimental at this time, but is being used throughout that area. And the idea is that it gives forecasts a climatological context based on the location and time of year. I won't go into it very much more, but I can provide further information if anybody's interested, or point you to where you can find out more information about it. So this leads to considerations of sector-specific heat forecasting. There's various sectors, all with various needs. I'll give you a great example that I've had within Canada. Our health partners really, really want to know as much information as possible, as soon as possible, and they're quite fine with the uncertainty associated with that information and to provide that uncertainty. Whereas our emergency management in Canada wants to know when it's going to happen. They don't want the uncertainty. They want to know that they have to put their action in place now. Also, of course, the needs of infrastructure, the power load. Interestingly enough, learned recently it's humidity that's quite a factor in terms of power load, which is something I never would have known. Mass gathering events, I point to this one because the development of most of our modernization of our heat warning program in Canada has been because of the Pan Am Games and wanting to harmonize heat warnings. And then, of course, whether it's the public or vulnerability groups. So that does give me just a few minutes to sort of touch on our own heat warning system, I believe. And so I just want to give a brief overview. There's a lot of information on this slide, but that was intended because I knew it would be left over at the end so everybody can read through. But the most important part I want to show you is that up at the top here, I have an image on the left-hand side of what the heat warning criteria was across all of Canada in 2014. The majority of the country used a single climatological index, or climatological level of 40 humidex. This was originally developed in southern Ontario, and because the rest of the country felt they needed a heat warning, it was expanded right across. That was it. There was work done in the lower mainland area of British Columbia, this purple area by the British Columbia Centre for Disease Control. And they did develop evidence-based heat warnings following the event in 2009 that did cause excess mortality. And that was our first evidence-based heat warning criteria, but that was not developed by Environment Canada. We adopted it, and we worked with the province to provide that information. So that led us to, why should we go where we want to? We knew there was a need to move towards evidence-based heat warnings, and we knew that because the country is so vast and large, there needed to be some kind of variation in how that worked because of acclimatization in each of those regions, or possibly that small spread or large spread of temperature variation and tolerance, right? So what we did was we did go through and do heat health analysis where available and where we could, but Canada has another issue, population density, and that makes it very difficult to perform a lot of health evidence or health studies and analysis because we just don't have the population base with mortality and morbidity data. Not to mention we don't keep mortality and morbidity data coded as should in all cases, depending on the province. So we did use the 95th percentile as guidance in those regions. Prince Edward Island is a great example, definitely not the population base to do any type of mortality heat health analysis. I mentioned already we consider duration, so the way we developed our criteria is that we have a maximum and minimum temperature component using 2 consecutive days of reaching a maximum temperature with with an overnight low that you cannot drop below. So the idea of no relief from heat overnight. And we did determine, or we pushed temperature to be part of that instead of humidex because it was our best predictor. So there's lots of other considerations, but I'll leave it there.
Thank you, Melissa. There's a whistle-stop tour, and I think there were some really interesting questions that came up. Just to flag them so that you have them in your mind for the next talks and for the panel discussion, the ones that I picked up on were warning fatigue, how you juggle the need to warn people and to not, and to avert impacts with not wanting to overdo people's patience in terms of warning fatigue. Trade-offs between probabilistic forecasting and deterministic, particularly as we're pushing towards longer lead times in order to meet demand. How do we deal with the uncertainty at those longer lead times in places which don't do probabilistic forecasting? And some issues around the threshold setting in Canada. Okay, we're going to move on to some regional case studies, which was a nice follow-on from the Canada system there. So can I invite, who was first? Thank you. Natalia. So Natalia's from the Meteorological Service in Argentina. She's going to tell us about the early warning system there. So Natalia, I'm going to
Good morning, I'm Natalia Herrera. I work in the National Meteorological Service in Argentina. I'm going to talk you about the Heatwave early warning system in Argentina. This system is very recent. It was implemented for the first time in our last summer. Oh, okay. The National Meteorological Service and the Ministry of Health and Social Development have been working together since 2015 in a research about mortality and heat waves. We compared the mortality that occurred in the summer 2013-2014 with the mortality in the 3 previous summers. We find significant increases in the mortality rate, and in that summer, almost 1,900 deaths in excess were registered. Moreover, the death risk increased in 13 of the 19 states analyzed. More details of this study are being presented by Francisco Cecchini in term 2 parallel session. The result of that study plus the evidence of the increase in the frequency, intensity, and duration of heat waves took us to think and develop an early warning system to contribute to reduce the impact on the population's health. Fortunately, it has been a successful experience. Well, as a precedent to this system, since 2009, we had a heatwave early warning system in the city of Buenos Aires, and in 2013, it was replicated in Rosario, which is another populated city. The system was readapted, both the conditions from which the alerts are issued and the area of influence. Our proposal was to create a new system, including more cities based on a clear and objective criteria with automatic triggers. Well, there are a lot of possible ways to define a heat wave. It is a period of unusually hot weather, generally with an appreciable impact on the human and natural systems. The Argentinian Meteorological Service defines a heat wave as a period of time in which maximum and minimum temperatures are above 90 percentile. These values are, are less for 3 consecutive days. These values are calculated based on daily data from October to March in the period 1961-2010. This is an example of how the system appears on the web. The system issues a daily alert from October to March for each of the 57 cities located in the center-north region of Argentina. This alert is valid for 24 hours, and the system has 4 alert levels. A green alert indicates normal temperatures, both observed and predicted. There is no danger on the population's health. A yellow alert indicates a heat wave forecast. There is a mild to moderate effect on health. Heat waves can be dangerous, especially for risk groups like infants, young children, people over 65, or those with chronic diseases. An orange alert indicates an observed heat wave. There is a moderate to high effect on health. Heat waves can be very dangerous, especially for risk groups. A red alert indicates an intense or persistent heat wave. There is an extreme effect on health, and they can affect all healthy people and not just risk groups. Well, here are some examples of how each alert is activated. For example, a yellow alert is activated if there is a heat wave forecast for the next 3 days, or if one day with heat wave condition is observed and there is a heat wave forecast for the next 2 days, or if 2 days with heat wave conditions are observed and there is a heat wave forecast for the next day. An orange alert is activated if 2 days with heat wave conditions are observed and there is a heat wave forecast for the next day with the maximum temperature forecast higher than 99 percentile, or if a heat wave is observed and there is a heat wave forecast for the following day. And a red alert is activated if 3 days with condition of extreme heat wave are observed, exceeding the 95 percentile at maximum temperature, and with a forecast of heat wave for the next day with a forecast of maximum temperature above 99 percentile, or if there is 4 days with heat wave conditions observed and there is a heat wave forecast for the next day with maximum temperature higher than 99 percentile. Okay, we are now working with the Ministry of Health to activate the red alert for non-weather issues like power shortages. Once the orange or red alerts are activated, they are not deactivated until the heat situation ends. This is due to the fact that the greatest increases in mortality occurs in the later days of a heat wave. When the National Meteorological Service issues a heat wave alert, the Ministry of Health gives recommendations for general populations and vulnerable groups. The dissemination of heat advice to population involves the web site of the ministry and mass media campaign. The Ministry of Health is working in a communication flow diagram in order to inform the state of heat wave alerts. If you want to consult each one of the criteria carefully and more details about the whole system, you can review a technical report in this website. This is in Spanish. This is the last one slide. I'm going to show you an example of how this system worked for Buenos Aires in our last summer. You can see the red bands represent the 4 heat waves that were registered in that summer. It was a very active summer. You usually have 1 or 2 heat waves per summer. Red and blue lines with dots represent maximum and minimum observed temperatures, and light red and blue constant lines represent the 90 percentile of maximum and minimum temperatures. We can see that every heat wave was preceded by a yellow alert. And when there was yellow alert, in the following days, relatively high temperatures were observed, even though we didn't have a heat wave. There were not alerts at the end of the summer, when temperatures were farthest from reaching the thresholds. If we had frequent or inaccurate warnings, the system would lose its credibility. Thank you.
We have time for two very quick questions before we move on to the next
I come for Jeff.
Thank you, Natalia. Very nice presentation. I like especially the way you formulated the relationship in the last slide between when you see the different alert levels and the temperatures that go with it. One question though, your thresholds are season specific or are they annually based?
From October to March, we have daily temperatures and the 90th percentile of maximum and minimum temperature.
For the warm season.
It's one threshold for all season.
Okay, all right, thanks.
Thank you for the excellent presentation. Your thresholds are based on the period up to 2010. Given that we are seeing a rapid increase in, with the climate change, don't you see that you are probably, your thresholds are relatively low compared to what people are experiencing on an everyday basis? Don't you think you will get too many thresholds if you compare with a climatological normal, which is up to only 2010?
percentiles, we calculated them over a period that ended in 2010.
Yes.
But we have warming.
Yes, maybe in 2020 we have to calculate the percentile.
Yeah, but there is also a possibility to use all the available data up to the latest last year, which can provide a more realistic this kind of characterization of the heat wave, because people are already in a warmer world, and I think we should be able to capture the real anomalies above the climatological normal.
Next up, we have Subash Bhan, excuse my pronunciation, speaking about the experience from India.
Oh, yeah, I know. Good morning, everybody. So, after the South American experience, now it's the Indian experience of the heat wave warning system, the observations and escalation to different sectors. Does it work, Natalia? Oh, yes, it's working. The main hot weather period is from April to June. Heat starting, in fact, building in month of March from extreme southern parts of the country and in Sri Lanka, and then spreads in area to northern parts. And May is the hottest month if you take on an average, and largest area under hot weather. If you see here, June, the area of hot weather shrinks considerably in the month of June due to onset of southwesterly monsoon. But up to the same period, up to middle of June, it remains fairly hot up to central parts of the country. And whenever the monsoon is delayed, the hot weather season prolongs and remains hotter even up to southern parts of the country. So the monsoon controls the length of the hot season. That's really an issue. On the extreme right, here is the observation network. The typical observations, about 300 of them we get synoptic weather stations. This is for the date in this year. Okay, I need to use this. These are the decadal heat waves and severe heat waves. The blue bars are for heat wave. I'll come to the criteria in next slide, perhaps it is there. And the red ones are the severe heat waves. They are increasing if you see the decadal things. They are averaged for a number of stations in core heat zones of the country. And then there are, if you come here, there are considerable, intra-annual variations in terms of number of days and the areas impacted. The country is divided into 36 meteorological subdivisions. So the number of subdivisions being impacted on a particular date and the severity of heat wave varies considerably within a year itself. If you come here, the area bounded by this red line had some time or the other in the past has experienced a temperature of at least 46 degrees Celsius and more, and a heat wave of 10 days or more. So this is the core heat zone of the country, gets very severe sometimes. Observations, as I said, around 300 real-time reporting synoptic weather stations. Number looks big, but considering the size of the country, it's not. We are having a network of 625 automatic weather stations. But there, as of now, we are facing the issues of continuity of the data, consistency of the data, quality of the data. We are struggling with that. Probably we'll set it right, and that should give us fairly good amount of observations across the country. Because country has roughly 700 districts. So with these synoptic observations, even half of the districts are not represented. Then we try to make up with generating graded data at half degree by half degree interval, but that has its own problems. Smoothing errors comes in, and a particular district manager says, "Oh, I'm feeling more hot than what you have told." So those kind of issues we are facing. I'm flagging the issues here. And all the data are archived. Whatever data is real-time available to the users, whosoever wants to use it, we make it available. The heat wave criteria, it's based on daily average temperatures from 1981 to 2010, Dr. Rupakumar. And we have a policy of updating the normal every 10 years. So normals up to 2020 will be updated maybe by 21 or so, by end of 2021. So heat wave we define when the daily departures of the daily actual temperature is by 4.5 or to 6.4 degrees Celsius. And if it's more than 6.4, it becomes a severe heat wave. And then there is a condition attached to it. In the plains, the actual temperature should reach 40 degrees Celsius. If the temperature actual is 38, even if it is 7 degrees warmer, it's not called heat wave. And that limit is 30 degrees Celsius for the hills. But when the actual temperature reaches 45 degrees Celsius, we call it heat wave, irrespective of its deviation. And for 47, it's severe. And for the coastal area, that limit is 37 degrees Celsius. When it reaches 37 and the deviation is 4.5 degrees Celsius, we call it heat wave. And the issues here, what we are facing, it's based on only on temperature. It's not based on impact. Our forecasts are not based on any impact. And also our advisories of the India Meteorological Department so far were not carrying any advice. We just call it's going to be heat wave in this district, in this meteorological subdivision. No advice attached to the users. What should they do and what should they not? The other issue we are facing really, let's assume today it's 43 degrees Celsius at two places. One in central parts of the country will not qualify to be heat wave because the averages there are around 41, 42. And the other station in northern parts of the country or northwestern parts of the country having the same temperature, we will call it heat wave. Because the normals are about 37, 38 maybe. It fulfills the criteria of deviation of 4.5 degrees Celsius and more. That's an issue with the users sometime. We are facing. And the form city, because the normals within the season for a city rise, they are based on daily averages. For today, there is one normal, for tomorrow it will be another one. So it has a rising curve. 43 degrees Celsius in the beginning of the season or towards end of the season would be called heat wave for a station in central India. But during the peak, say 15th of June to 15th of April to first week of June, it won't qualify to be called heat wave because the averages are close to that. So same temperature heat wave in one part of the season, not in other parts of the season. Use of heat index. We used it in 2015 for the heat index based on the NOAA formula. That really did not work for many regions. Number one, it says valid up to 43 degrees Celsius, not valid beyond 43 Celsius. And getting 44, 45, 46 is common for us. And for different combinations of temperature and humidity, it provided some very unrealistic values. One example here I'm giving, a combination of 45 degrees Celsius temperature and 15% RH, which is very common in central parts of the country during summers, yields a heat index of about 44.5 Celsius. And 35 degrees Celsius and 75% RH, which is common in coastal areas, yields a heat index of almost 50. The first resistance we got was from our field offices. We have a weather forecast office in each state of the country. They really had objection to it. And they objected to it because they are the persons who are interacting with the users further. They said that it does not look realistic and it's creating problem. We stopped it. And as of now, we don't have, because this requires a lot of survey and health related data. So we don't have a heat index, we don't use it. That's the state of matter as of now. We need to do it, probably find partners in some academics or health department. And how do we operate? At national level, from 1st of April to 30th of June every year, a specialized desk is created. A few officers drawn from the forecasting setup are assigned this duty from morning to evening for monitoring of the temperature, observations and preparation of forecast products, both from NWP and system generated. And I tell you, our products are not directly NWP generated. There are biases in the models, there are errors in the models. Human intervention is done for all the CTs and meteorological subdivisions. Therefore, we need probably more number of people to work on that. And the forecast system goes like this: a detailed bulletin of heat wave related bulletin is issued at 1600 hours daily, valid for 5 days, 5 days including that day. But by that time, that day is over for heat purposes. For 1600 hours, that day is gone. So practically it is 4 days. And based on the user feedback upon that, from last year, 2018, we introduced a bulletin in the morning that goes out by 8 o'clock. It's quick bulletin by 8 o'clock for that day. If some actions are required to be taken for that day, it reaches all the users by 8 a.m. in the morning. But the heat wave is also part of multi-hazard early warning system of the country. It's one of the components. And that detailed forecast goes out by 12:30 or 1 o'clock daily. So that's how it goes. And that desk also comes out with a weekly bulletin giving outlook for next 2 weeks. And these are the thresholds like all other countries, the same color. The forecast setup, we provide a seasonal forecast twice in the season. I told you yesterday, one on 1st of March and other in 1st of April, out to next 3 months. That gives the areas which are going to be impacted. This is the outlook this year, issued on 1st of March. Then we have monthly forecast system for the South Asia. I'll take another minute and a half, if you permit. Every month for the region, we give out for next 8 months outlooks. And this is the extended range forecast system. Dr. Sahai is here. We can interact with him later. He is the creator and the master of the system. This gives weekly outlooks for next 4 weeks. And it's a very good system to tell us that this area is going to become warmer or become colder. So the managers can be alerted well in time. They can review their preparedness and system. And when the actual week comes, then medium range scale forecasts, which are far more accurate, can be provided, and they can put their actions in schemes into action. Other issues, this is the last slide perhaps. The definition of heat wave is an issue. Stakeholders are not that well engaged. We are into it, we are trying, we have succeeded to an extent, but still we need to engage more of them. And if I can go back this year, this is important. The forecast we have started providing to the power sector. And from this year, we are engaging them to tell them that this area is going to be heat impacted and manage your electricity supply well. And in dissemination, from last year we added to all other normal means of dissemination. This IMH, Indian Medical Association. Nearly all the practicing doctors, including those in government hospitals and private practitioners, are members of it. So we provide it to IMA, and then IMA through their channel provide to each and every practicing doctor in the country the heat wave forecast for his or her district. Indian Red Cross, they also have footprints across the country. So we are providing to them also, they provide to their district centers. Then CAP, a Common Alert Protocol. It goes to all the people in the area. Suppose the district is impacted, everybody having whatever mobile number will be given. And this import AMFU, we have a system of providing agriculture forecast, so that also is utilized for heat wave. Then issue of health-related data is an issue like any others. Cities' health plans are working better than states, that's normal. Other lessons are involvement of stakeholders is important, and the most important was the involvement of the NDMA, the National Disaster Management Authority, as a central agency in between. That really catalyzed the problem. We were providing heat waves forecast for very long. It became effective when NDMA came into force. Future plans. Thank you, Hannah. We have elaborated. We have Prime Minister's Council, and it got 8 major programs out of one mission on health and other mission on strategic knowledge on climate change. Both cover the heat-related issues. So they are there. Thank you.
I'm afraid we don't have time for questions right now. We'll have more discussion in a bit. But certainly some very interesting points that seem to be very India-specific. So issues to do with what the appropriate heat threshold is for health in such an extreme climate. I wonder if Australia and India could perhaps have some common messages.
Probably we have another round of discussion today.
Absolutely.
Yeah.
So pleasure to welcome now Cedric Van Meerbeeck from the Caribbean Institute of Meteorology and Hydrology to talk about the... You're welcome, thank you. To talk about the Caribbean.
Thank you, Hannah, for making the common mistake. It's the Caribbean Institute for Meteorology and Hydrology. Imagine that I was saying the International Research Institute of Climate and Society. Wouldn't make sense. Right? It doesn't matter. Unlike yesterday, I'm not going to build a whole story around my presentation. This is more technical. But I just want to start with the human dimension again by saying, for instance, my family who lives on a very small island, well, my wife's family, I should say, that small island is 14 kilometers in length, but about 1 kilometer in width. There are 5,000 people. My mother-in-law in December feels cold. At the same time, on the other side of the island, my uncle is feeling too hot. What's the difference? First of all, of course, it's a personal difference. Some people are more susceptible to feeling hot, some people are more susceptible to feeling cold. But there's that other big difference, that is the wind. One side of the island is wind exposed, the other side is not. Can you factor in the wind efficiently, effectively, in a heat stress index? That depends on the network of observations, that's one thing. But it's also depending on, are the people really exposing themselves to the wind or not? And that's a very hard factor to consider when you think about forecasting, right? So although we are aware, and I'm sure that all of you are aware, that wind can really bring you a lot of cooling unless the temperature is really, really high, like I think around 50 degrees or so, it doesn't even feel cool anymore at all. It actually helps heat up your body. But at lower temperatures, indeed, it brings you cooling. And so a lot of the infrastructure is going to help you better than a forecast in preparing for heat in that case. So that's why I believe that in the case of the Caribbean at least, adding the wind in an apparent temperature index is not really going to be very effective. So instead of doing that, maybe a heat index works better that just considers temperature and humidity. So when we think of ambient temperature in the Caribbean, and that's the case in most places, I guess, the records are sufficient to provide long enough records over the entire area of the Caribbean so that you can get started with something. But in the Caribbean specifically, as is the case in many tropical areas that are coastal, you have a strong dependency of the heat stress on humidity. And so there's a problem there because humidity is a factor, is a variable that is only measured at the international airports in the Caribbean, nowhere else. And the international airports in the Caribbean don't have a mandate for climate. So they don't keep track of humidity, of relative humidity, for instance, except a few, right? So you don't get the records that you need for building statistical models. But what else can you do? Well, in order to get a heat stress index, instead of using relative humidity, the manual stations, well, they typically have a minimum temperature thermometer, a maximum temperature thermometer, and they also measure the wet bulb temperature. So that is one thing that we can draw the humidity from. If you think about automatic weather stations, many of them don't, estimate the wet bulb temperature, but rather they calculate a dew point temperature. Either way, both of them can be easily recalculated and incorporated together with the ambient temperature into a heat stress index that is, like for instance, the US heat index. Would the US heat index work in the Caribbean? Well, since you have a similar climate in the Caribbean as you have in the summer in the southeastern US, it can be a first approximation that it could be workable, right? But to get started, we don't even have those records. So we try to figure out a way to raise the awareness on what is happening with heat in the Caribbean, in a region that is always hot, or at least that's the perception, right? We started with temperature anyway. So I want to show you, okay, are there some reasons for which we can say it can work, and what are the limitations? So here I give you a station, that's the airport station in the international airport in Suriname. Suriname, which is of course on the South American continent, but is culturally part of the Caribbean. And what I draw here is on the x-axis, maybe I can use this, no, that's a bit too small. On the x-axis you see the categorized, I don't see my cursor appearing. Yeah, okay, so categorized temperatures, but based on the US heat index. So 40 to 42 degrees feels warmer than your own body temperature, in other words. So what is their observations in terms of heat stress? So if you see the green colors, that would be a comfortable temperature. Anywhere you start seeing yellow and reddish, that's heat stress. Anywhere you start seeing bluish, it's cold stress. Now I guess that you can see, especially if you come from a mid-latitude, how narrow the bandwidth of comfort is, right? And so if you look at it, very seldomly do they get a heat index that's really starting to become, that possibly starts to become dangerous in the healthy population or in the more susceptible population. But you really don't need a lot of time to be in that high index value to actually see a lot of stress. So that's why I calculated here the percentage of time on the y-axis that you are in that category rather than how many days, right? Because it's a percentage of time that really puts you at stress. It's the duration of the time that you are at stress that could be a factor. But is that really something that you can look at in forecasting? That's again another question. So I've shown this slide yesterday. I'm not going to go into detail here. Just one thing I wanted to mention with respect to the numbers that are here, now that we're mostly meteorologists and climatologists here, these are so-called heat wave days. We call a heat wave day any day with the maximum temperature being in the above the 90th percentile. but for at least 2 consecutive days, right? So a hot day would be above the 90th percentile, a heat wave day if it's at least 2 consecutive days. So when you calculate then the number of heat wave days climatologically, in this case, Hannah, that was from 1991 to 2011, I believe, right? It was about 21 years or something. Yeah, so by the way, this is work we've been doing together with the IRI. What we see is that the seasonality of heat waves depends on where you are in the Caribbean. So Suriname, that station that I showed you just a while ago, is right here. And this region, this area here is called the Guyanas, which is French Guyana, Suriname, and former British Guyana, are now called Guyana. This is one sub-area that has its characteristic seasonality of heat waves, which is in red here. So no heat waves virtually until July, and then from August to October to November, that's the heat wave season. Why is that there? Well, it's a large, by Caribbean norms, it's a large land mass that has its longest dry season in that season. And so basically the land surface is really the main cause for heat waves in that area. Do we have a lot of blocking patterns? No, it's near the equator, right? So you don't see that there. If you look at the other extreme, you have here Belize, which is in the westernmost part of the Caribbean and also part of Central America. They have a completely different seasonality. You can see that in April you start seeing the first heat wave days. Then in May you get your summit, you get most of them, and then it decreases. What is happening there? That's more like a monsoon, where you get your heat just before the wet season, right? There is no real monsoon in Belize, but the characteristic of heat is similar across many areas in Central America. Then you have another area, which is the Greater Antilles and Bahamas, where basically you have a summer season, and that's where you find the heat waves. And then you have the Eastern Caribbean, where you have that particular difference between the windward areas and the leeward areas. In other words, the wind exposed and the wind sheltered areas. And if you look at it, in the wind exposed areas, which is this light curve here, you only see one peak of heat waves, which is late in the season. In wind sheltered, you actually have a pre-wet season peak and then a middle of the wet season peak. What is happening there is, if you look at it, most of the areas observe heat waves around August or September. Why is that? That's when the sea surface temperature are warmest. What do you get there? You don't only get heat waves in terms of temperature, but that's also when your humidity is highest. So that's when you expect your heat index to be highest too. So yes, you do get a lot of heat waves in wind-sheltered areas pre-wet season, but those are dry heat waves. Those are easier to cope with. You get the wet heat or the humid heat waves later in the season, and that is when every year I hear people around the Caribbean saying, pardon the slang, it never been that hot. So they always forget how hot it gets in the month of September, in other words, right? So the sea surface temperature is the first cause for heat wave days, which means that ENSO is a good predictor on interannual scales, and that makes it so that we can actually form a prediction model at the seasonal time scale for the number of heat wave days within a season. So whereas this predictive skill for 1 to 3 day heat wave forecasts, so the weather type of heat wave forecast, has a little bit of useful skill perhaps, but nearly none beyond 1 week. And together with the US Regional Climate Center in demonstration phase, which Wasila leads, they have been looking for the Caribbean at the possibility of producing forecasts using their system at the subseasonal timescale of heat waves according to our definition. And you can see that there's no useful skill, and that is not surprising because we don't have large-scale features other than the sea surface temperatures that define when there's gonna be heat waves anyway, right? So how do you predict something related to heat stress without having the problem of having a coherent pattern of when there are heat waves across the region? Because they are not coherent at all. So one of our approaches was demonstrated in this figure that I showed yesterday, where you can answer typical questions or very specific questions related to heat stress along the season. Now, not predicting the average temperature or the temperature anomaly, but specifically looking at how many heat wave days do you expect. And so one question that you could ask for is, what's the probability of having a certain number of heat wave days in the season? Or you could also say, okay, what's the maximum number of heat wave days that I expect at any station in the Caribbean over the next season? So those are questions that you can easily ask. And the advantage of such a prediction system is that actually most of the signal is climatology. And it's only when you have predictability, when you have skill, because of an ENSO, for instance, that you get additional information from the forecast, right? So that is a system that allows you to give the most confident information, not skillful, confident information, regardless of when you have skill or not. So that's why we set up such a system, and that's an idea for maybe also other countries to consider when you look at the seasonal extent of heat. Use your climatology as your basis, and when you have skill, you can add to that some forecast information. Thank you very much.
Thanks very much. Okay, so we're going to move on now to a panel discussion, which will be chaired by Dr. Kumar Kohli, who is from the World Meteorological Organization. Kumar, I'll allow you to introduce your own panelist.
Thank you, Hannah. Good morning, everyone. My name is Rupa Kumar Kohli. The Chief of World Climate Applications and Services Division in WMO Secretariat. I work closely with Joy to help with the climate services for the health sector. In fact, since we are already behind schedule, without going through too many aspects in terms of introducing the topic, I would like to actually have a relook at the title of our theme. It's actually weather and climate information to facilitate action. So the key word here is actually action. So we are not generating or providing this information to satisfy an academic curiosity, but to actually help people to take specific actions based on this information. So we had an excellent set of presentations which actually provided the essential background and also gave us a number of ideas that for us to help us to brainstorm on how best we can address the objectives that Julie has actually reminded us today morning that we are expecting from this forum. So now, without much ado, I would like to invite our panelists who will help us with sharing their perspectives and then followed by a short discussion from the floor to tease out some conclusions and recommendations on this theme. I invite Dr. Serge Jonicourt from the French Research Institute for Development. Please come and take the dash. He is currently running a project on the establishment of warning systems for heat waves in the Sahel. So he will help us with his perspectives based on his work there. And we have Dr. Melissa MacDonald from Environment and Climate Change Canada. She needs no introduction. We have heard her extensively, and I'm sure you know her work very well. We have Dr. Inoka Suravira from Sri Lanka. She is from the Directorate of Environmental and Occupational Health in the Ministry of Health of the government of Sri Lanka. She has been involved in the development of national adaptation plans for Sri Lanka and also developing the heat health action plan for Sri Lanka. And finally, Dr. Vasila Chow, who is the team leader of the NOAA Climate Prediction Center International Desks, and he has been leading the development of real-time climate products for the health sector. And among many other things, he also has a long experience in capacity development for developing countries. So as you can see, we have an excellent collection of different facets of this topic, helping us to look at the research, the operational aspects, the user aspects, and also the capacity development aspects. So the panel discussion is organized by a 5-minute intervention by each of the panelists without going through any PowerPoint slides. So given the shortage of time, I request the panelists to respect the time limit so that we'll have some time for open discussion. To start with, I give the floor to Dr. Johnny Kaur.
Okay, thank you. Good morning, everyone. So I've been asked to address the issue of data in developing country perspective. So I see two objectives. First is to addressing the heat health modeling issue in order to build a robust model heat health relationship. Then I consider that we need to define accurate and sector-specific biometeorological indicators. That means first to use basic meteorological data. As the first priority we have, as we have seen very often, temperature and humidity information. In the second priority, we can consider wind and solar radiation, which are parameters less available in the Met services. And third, we can also use visibility information as a proxy for dust content, especially in rural areas, but also addressing the issue of urban pollution. Another issue is time sampling. Ideally, we should need hourly data, in particular to have a robust estimate of extreme temperatures or extreme humidity information. And this not necessarily available in Met stations, especially of a digitized form, under a digitized form. Another issue is the spatial density. We need a rather dense and regularly distributed stations to be able to consider some high temperature and moisture gradients that can be present in some countries in the tropics. We have also to consider the quality of the data, and in fact we often have to cope with a lot of missing values in station records or spurious values. For instance, we have done some quality tests of West African stations, and finally we could only select it from 3 to 12 stations per country, which is not globally enough to have a good coverage and a good information for covering all of the country. So maybe we can develop some disaggregation or interpolation tools, especially integrating satellite information in order to complete this in situ information. But again, this needs good in situ data to calibrate this information. Another point which for me is very important is that the weather station need to be as close as possible to health and population observatories or district health centers in order to be able to build robust model heat health relationships. And this is not always the case in developing countries. A second objective is how to go from science to action. I think one important issue which has been also oftenly addressed yesterday and today is to develop a seamless forecast system in the context of operational forecast. So the IRI has developed a ready, set, go concept from seasonal to mid-range and short-range forecast. We have seen that seasonal forecast could provide significant information in the tropic, especially linked to the El Nino occurrences. The weather forecast can also provide useful information for some days ahead. And but what I think is where we have to put specific effort is what we call the S2S scale. That is weeks 3 and week 3 and week 4 range ensemble forecast. Because when you are speaking with district doctors, they said us that what they need is at least information 2 weeks ahead. Another issue is to provide long-term historical and climate projection data for long-term planification. And then it's necessary to be able to produce homogenized historical long-term climate time series. And ideally, this would be provided at the daily time scales. And of course, in developing countries, this is very, very difficult to provide such data because metadata are not available most of the time. We can provide climate model data for climate projections, but this need to include bias corrections. So again, we need good in situ data to calibrate these model projections. And what could be interesting is combine this climate projection data with health impact model data for providing heat health risk projections. Finally, I think that we have to set up portals to disseminate this data. For instance, this ongoing project in Senegal. Why? Because portal must be set up in main local meteorological centers, in particular to prevent the poor internet connections in developing countries. So in this portal, we can provide heat health diagnostics and associated seamless forecast products. These portals are also useful as a tool for communication to the general public, including forecasts at local scales. For instance, we can provide forecasts at health district level, and it can also be used to provide vigilance maps products in case of meteorological warning. And finally, I would say that the co-production of all these data and tools are necessary between meteorological and health services, including capacity building and training for accuracy and good appropriation. Thank you.
Hello? Okay, excellent. All right, so I'm going to take the opportunity to sort of expand a bit more and talk about the issues and how putting our heat warning program into action really operated. One aspect I didn't have a chance to mention earlier is that this was a partnership between our meteorological service within Canada and the Federal Health Canada, so our health body. Not to mention, it went even further, Canada being the size of country that it is, that involved having to have the provincial and territorial government level as well, but not even just that, the regional level. So it was really quite a project that involved bringing together multiple levels of government, which is not always the easiest situation. And that kind of led to difficulties in how to operationalize a system such as this. The science itself could dictate down to a much smaller level what heat warning thresholds or criteria should be used in a region. But to operationalize that, that wasn't possible. We are not that great at forecasting temperature within 1 degree from one region to another. I would like to hope that we are, but that's not the case. Not to mention the temperature variability. I kind of heard a little bit about earlier with our discussion, our presentation about India, but we have that issue a lot in Canada, especially along our coastlines. That temperature, or the ocean temperature, is so cool compared to the inland area that it's been very difficult, especially in regions like British Columbia, where we have a lot of mountains right up to the coast, and then also in Newfoundland, closer to Greenland, in that area, how cold the Arctic Ocean is, and to determine, with the lack of resource that we have in terms of observation network, what the actual inland temperatures are, for example, in regions there the population sits mostly along the coast, and how that's affecting the population. I heard earlier Cedric mention about wind. This is also a factor in many of these regions. There's strong wind, and how does that wind impact the temperature and the feels-like temperature of the people? And then another really interesting aspect was how to operationalize this within our forecast office, and how to convince our forecasters that this was something they needed to do. They really feel it's a public service announcement. It's not the big flashy weather that they're used to forecasting. It was really difficult to explain to them that we all know that extreme temperatures cause more mortality than any other weather phenomenon, that forecasting a heat warning was more important than forecasting a tornado. And I wouldn't necessarily classify one as being more important than another, but to be able to juggle that in a forecast office, as I mentioned, that's covering an area larger than, example, Ontario, I think, is larger than many of countries. I'm trying to think of a good comparison, but we'll just say central Canada, the entire province, and there's 3 forecasters for the entire province, and there's one that's concentrating also on marine weather and severe weather at the same time, and to be able to juggle what's required within that forecast office. There's also been an issue with public buy-in, the belief that they actually have any issues related to heat, and that they should pay attention to the forecast, as I've mentioned, in terms of overwarning. And how to get the information out. So we did develop an early notification process where we issue early notifications just to our partners 2 to 3 days in advance of an actual heat event to try and give them time to spin up their action response systems. However, we've had difficulties in making sure we get that information timely to them, as we've promised, but also there's been now more pull and requests for more information. And when you're operating in a weather service with pretty limited forecast capabilities, to be constantly being called in the middle of your forecast to have more information about whether or not that heat event's going to happen is very difficult on forecast operations. And we're trying to learn how to balance providing the service at the same time as providing the forecast, and there's going to have to be trade-offs eventually in terms of an automated forecast or an automated system to be able to notify those people, at least in the context of Canada, until we maybe hit a turning point where possibly more forecasters or possibly better systems. That's what I really have to say.
Good morning, and thank you very much for the opportunity. Well, I've been asked to talk about the demand side of this, and demand side perspective, lessons from Sri Lanka, what has really worked there and what has not worked. So before I start, I would like to briefly tell where Sri Lanka is, because some of you might not know. Well, it's a small tropical island in the Indian Ocean, and it has a land area of 65,000 square kilometers. So basically it has a tropical climate, and I have to tell you, the climate has been fairly regular, so people are not used to all these extreme climatic events from the past. But unfortunately, like you know, since 10 years or so, we are experiencing more climate adverse events, such as the temperature going up, more landslides, more heavy rainfalls, floods, so all that. So with that, of course, these climate information as well as the forecasts have become really important, especially coming from the Ministry of Health in the health community, Now these forecasts have been very helpful for us to prepare the people, change the behaviors of people, because we have been issuing advisories and then, in Sri Lanka, they listen to health personnel or officials. So this has really helped, to reduce morbidity as well as mortality. But in addition to that, of course, influencing the other important stakeholders. For example, now there was a time where they forecasted about temperature extreme events. And then, as the Ministry of Health, we had discussions with the Ministry of Education. Why? Because this particular period, the Ministry of Education has planned so many sports events. And then, of course, we were able to influence the Ministry of Education to reschedule the school opening and then the closing times. So with the forecast, of course, we were able to do so. And in addition to that, this has really helped the Ministry of Health to be prepared for such emergencies, because we need to activate the health system to cater to all these adverse health outcomes, especially in terms of all these natural disasters. You have to prepare the health systems, and then not only the curative health sector, but certainly the preventive part, because now in Sri Lanka, of course, we have the central health ministry, and then we have the provincial health systems, and then the district systems. So all coordinate, and then we have been able to send the messages, and then even the preparedness to go to the grassroots level, so that we have better preparedness. And in addition to that, of course, the forecast as well as the climate data mainly has been very useful for us to predict the trends. Now, when it comes to Sri Lanka, of course, the elderly population is increasing, and non-communicable diseases are really a burden. We don't have malaria. Malaria is eliminated, but dengue is really a problem in Sri Lanka. So setting trends and then identifying the trends has been very useful in terms of dengue, because we need to sort of, activate our preventive health sector as well as a curative health sector to respond to the dengue epidemics in a better way. And of course, what has not really worked in Sri Lanka. Now, because as health personnel, we need these things to be timely. Because I can remember there was this incident where they forecasted about a storm, but unfortunately, when they did that, the fishermen, they had gone to they were in the middle of the sea, and then so many died due to that. So, which is quite unfortunate. And then, of course, the accuracy matters, because, as I told you, people in my country, they are not quite used to listening to these weather forecasts, because it has been quite consistent throughout. Now, if we don't provide them with accurate information, so they will not have faith in this system. So that is going to be really, really upsetting the whole system. As well as for us to activate the health system. So it is very costly, so we should not be doing it unnecessarily. And on the other hand, especially in terms of climate data, we have been using it for research purposes, because we have to understand the epidemiology of most of these climate-sensitive diseases, which are really a problem. But unfortunately, the climate data is very expensive. And sometimes we have not been able to, as the health community, we have not been able to, get this climate information, so that even for our research students, it has been a problem. So I propose that we look into this, because I always believe that, to tackle health problems, multidisciplinary research is very important. So the meteorology community and then the health community and maybe the others, we have to really get together so that at the end of the day, we will be able to protect human health as well as this environment. Thank you very much.
Thank you. Thank you very much for the organizing committee for inviting me to talk about this interesting topic about building integrated capacity within Met Services for Health early warning system. And I have only 5 minutes to talk about this big, challenging topic. I actually have to read my notes in order to make sure that I keep up with time. So I will talk about opportunities, challenges, and also recommendations, my own recommendations for moving forward. So, but first, to what extent the current available information products are meeting demands. So, and when we talk about meteorological services, usually WMO really refers to meteorological services from developing countries, so this spans the whole tropics. So obviously, we know that there are meteorological services that are more advanced than others, but many of the Met services provide limited information, often focused on weather forecast products, agrometeorological information, and special reports such as climate outlook forums, bulletins. So the question is, does this information meet user requirement for health early warning system? So in my view, I do not think we are quite there yet, and we have really some work to do. But I think that we can get there. This issue is challenging not only for developing countries, it's challenging also for developed countries, including the United States, and we have heard from Canada. I think that they're moving forward, but they also have some challenges. Australia, the same thing. India is an emerging country. Also, they do have some issues, but they're getting off the ground. But we need to realize also that health early warning system is really new. Climate-based health early warning system is something relatively new. So we can get there if we persevere, but also if we create opportunities, and I think that funding is part of it. We have to also work together. So I'm going to just talk about some of the opportunities that are before us. So the fact that there is demand for climate information represents a huge opportunity to improve climate products and services. There is a strong interest from the international community to promote the use of climate information in decision making for health. So, and you know, the global framework for climate services and the national framework for climate services have helped national institutions actually to start organizing around meteorological services to accelerate climate services. This was not the case just about 10 years ago or before the global framework for climate services. I do know about international organizations that, you know, went to countries, put a lot of money, but, you know, I mean, they did not involve the Met services. So it's really through the establishment of the global framework for climate services and following the national climate framework for climate services that now people, institutions are starting to recognize the value of meteorological services. I don't think that if we're going to do health early warning, or any kind of early warning system that is climate-based, Met services have to be really capacitated to provide the right information. So another opportunity is the fact that we have made great strides in terms of improving weather and climate models. And this reflects in improved forecasts. So global producing centers, including ECMWF, UK Met Office, NOAA, Meteo France, now make available climate information that can readily be refined or used as guidance for products that can be tailored to the health sector. So we also know that WMO has created these regional climate centers that can also work with Met services to develop tools that will help meet the needs and requirement of the health sector. So how do we take advantage of these opportunities to make progress and achieve the goal of providing reliable information that enables action for public health? So the integration of health into the National Framework for Climate Services provides an excellent opportunity for Met services to work closely with Ministries of Health and Environment to identify needs and requirements for health services. However, the national framework is only one step forward. And I really emphasize it's only one step forward. there is a need, a strong need for institutional mandates and governance to enable continuous dialogue between Met Services and Ministry of Health, Environment, and all stakeholders through interagency agreements to define responsibilities and levels of engagement from each participating institution. So through this institutional engagement, Med Services can train participating health professionals in the understanding of the climate information being provided so they can provide useful feedback, and this feedback in turn will help Med Services to develop climate products that meet the requirements of the health sector and also work toward an efficient dissemination system of relevant climate information for early warnings. So another aspect, and some of my colleagues here also mentioned, is research. And operational delivery of climate services must be supported by research applications and transitioning this research finding into operations. So there needs to be a mechanism to encourage data exchange and the creation of databases. I think that Serge talked about the challenges with data that will support collaborative multidisciplinary research and development on climate applications that can improve early warning system. So I think that here joint projects between Met Services, health agencies, academia can be effective in helping make strides in improving climate services for health. However, funding is required, and I think we need to find ways to promote the work of a health early warning system to funding agencies to support joint projects that can help us move forward. So we do have challenges in accomplishing all of these things. So some of those challenges are institutional. Med Services do not have government mandate to provide information tailored to the health sector. I should say that most Med Services, not all of them. So thus, this requirement may not be a priority for them. So I know that through the National Framework for Climate Services, there are MOUs. But as I said before, MOU is just, the MOUs do not provide the resources for Med Services to carry out the work. So institutions in the developing world, and this is not actually just specific to Med Services, it also health services and environment, any agency in Med Services, usually they are short-staffed and resources very scattered, very thin. So this is a huge impediment for making progress. So some professionals in the developing world are overworked. Sometimes there is imbalance within organizations in the way workload is distributed. And I see that Kumar is getting up, so I have to hurry here and talk about infrastructural challenges. My colleague talked about the data issue. Capacity development is a huge issue because oftentimes there are just not the tools, to provide these products that we want the Med Services to provide in order to improve services. Another challenge is the threshold, defining the threshold. Some of the presenters before talked about the threshold issue, which really requires that Med Services work together with health professionals in order to really define the threshold that may have impact in health in certain population. So moving forward, some of the recommendations that I have for the organizers for enabling the climate-based health early warning system is, first of all, that we need to encourage interagency agreement. Really, there has to be commitment from agencies, multidisciplinary agencies that can work together, and they need to commit resources to enable the work to be done. So, so this will create we need to also make sure that we can have sub-working groups. And we have National Climate Framework for Climate Services. National Framework for Climate Services is great, but within the National Framework for Climate Services, we can have working groups between Met and Health and have them come together through briefings, and see how they can work together to really co-produce climate risk maps, that can maybe be used to advise government to make decision on and move toward health early warning system. So that's all I have to say. Thank you.
Thank you for that excellent introduction of the key issues that need some open discussion in this panel discussion. To start with, I probably would like to use the privilege of my moderating this session to raise a couple of points myself. Actually, Glenn highlighted the aspect of cascading of information from global to regional to local scales. So this actually is a fundamental aspect of the operational systems. And in fact, even if you are looking at the information provided by the local source, it's important to recognize that this is a result of this cascading of information. And we need to make sure that this is in place actually to provide information to facilitate action. There's another aspect that I would like to highlight is that many countries share common regional drivers. And in fact, the heat waves and the heat wave related systems actually travel within the region from one place to another place. It's important for us to actually look at it on a regional scale and help countries to jointly work on regional aspects, and also at the same time there are multiple sources of the same information, and to consolidate that there should be a regional cooperation. So in WMO we actually try to facilitate this process through what we call climate services information system with a specific regional focus. I think that regional piece is fundamental to actually support even the local scale warnings. So those 2 points I hope will come up for discussion at different points in this forum. So now to start the discussion, I would like to remind us on the question that Hannah highlighted this morning on at least three issues. That is, to what extent are the currently available information and products meeting the demands, and what is working and what is not working. More importantly, how we are doing in terms of information sharing, providing space-time relevance to the decision making, tailoring and presenting the information in the right way, meeting adequate lead times required for specific decision making, and communicating in a way that the information actually triggers specific actions to respond to the risk, and whether we have the appropriate variables and thresholds, and whether we are able to communicate the uncertainties in order to preserve the credibility of the operational warning systems. So this is a fundamental first question that we need to address. The second one is actually what are the main challenges in terms of producing information and meeting the demands. We have heard about the challenges in terms of observations and data, the capacity development on both the sides, tailoring and communication, and actually identifying some quick wins. There may be some things that are low-hanging fruit that we can actually take advantage of. And mandates, Vasila mentioned about the mandates, which in many cases prevent adequate use of information in specific actions. And there is also this dilemma of information that is easily accessible may not be of best quality that what one can access. So how do we make the best quality information easily accessible? I think that's a major challenge. How do we deal with that? And what are the opportunities, and how we actually work through partnerships and co-production and additional capacity. So these are the issues that I would like to place before you for a kind of open discussion. We have very short time available, maybe 20-25 minutes. So I open the floor for discussion. Yes.
Thanks very much,
I just wanted to maybe throw open the idea that Met services might not look like they are right now in the very near future. So I'm very conscious that when we think about what we're doing currently with our forecasters in Australia, we think very soon we will have virtually all of our forecast production, routine production, which is where a lot of this material would come from 1 or 2 centres only out of our country. And it's going to release a lot of our forecasters from the current grid editing that they're doing. And it's changed the way that we've organised our organisation. We used to put our environmental intelligence at the centre of our organisation. Now we put the customer there. And we're moving to the point where we want to put our experienced forecasters and operational people next to our customers rather than next to the data. So it's coming to everyone, because the simple parameters of temperature, which is driving most of the systems we see, are very well done by the machine. Extremely well done. And so, and down to the fidelity that you'd like to have, and the reanalysis pushes and everything else that we're seeing are actually beginning to create a very data-rich environment in which we can work. So very soon the ensembles will start to flow very quickly. We're going to have an enormous amount of data. The problem will be, how do you consume the data? And having experts sitting next to that volume of data rather than getting between the data and the customer is going to be the challenge for a Met service. So I just point that out because it changes the way you think about how we provide the data and what you might ask of us, because you can ask virtually anything and get it all. It's just, how do you then manage it? I think that's a challenge you need to think about.
Thank you. That's a very excellent point. Shubai.
True, because we from public health, I think we come from a very data scarce environment, and here we are talking to a partner which is getting a planet full of data every second, and it's been a challenge to sort of keep up with it in some ways. Be an equal partner, so to say, at the table. It's not enough to say that we are just consumers of that information. We need to sort of bring something to the table as well, which I don't think we as a community are quite well placed to do it as yet. But the fact that you brought that up, that the availability of data is just going to be even more, is somewhat of a challenge that we need to think of in terms of how we process it and how we then make these requests that align with this sort of incessant supply of information in some ways.
And if I could add, the possibility of doing global.
I think
the possibility that you can have global production systems rather than regional production systems. It's too easy. So multiple centres doing global products that enable you all to be aware of each other's issues, not just your local issue. I think if we acted like a global community caring about what our neighbour's going through as a learning experience in terms of the heatwave challenge, rather than waiting for the event to arrive on our doorstep and learning then, is, I think, a change in processing in our heads to being global citizens in the way that it's so easy in weather data to be a global citizen in weather. We can learn from, I was learning last season from Norway, Korea, Japan, China, in terms of the systems that I was seeing in my data. But I'd like to share that rather than just sit in Australia and look at only my weather systems going off.
so. Maybe the panel has some thoughts on this point.
I think that as a meteorologist working for a global producing center, I am very comfortable putting out products, global products that serve as guidance for meteorological services to enhance their, forecast capabilities and so forth. I would not feel comfortable putting out products, targeted for the health sector, unless I am sure that the health sector has looked at this product and has validated and feel that this product is important to them. So this is why we're trying to be extremely careful at NCEP as to what kind of product we put out together. We've been engaged in this, exploratory work to see if we could develop products that could meet the needs of and requirement of the health community. And we have built, a prototype website, but just for us for now, because we're careful. We don't want to put it out, and because it's going to get to hands of people, and and we don't know how they're going to use it until the time that we make sure that the health community will be, confident and comfortable with this product. We don't want to put it out together. So that's why this requires that we work together.
One other point, if it's worth it, just mention it. The national Met services have a dissemination broadcast mentality that is not connected to the digital era. Okay?
Osman. I have quite a few of them to ask, but I'll put one. And
please be brief because we have
I'll be brief.
Very short time.
One of the questions posed by a regional forecaster to us when we were discussing combination of temperature and humidity to be provided. At which point of time in the day it should be? Because the curves travel, in different directions in the diurnal cycle. At the maximum of temperature, the RH is the lowest. So should it be averaged over hourly or 3 hourly or the highest during 24 hours? Which one should be used? Because we are into the debate, and at some time we will come up with the system. This is a question which has come from a regional forecaster. So should it be at the epoch of max temperature or the highest during 24 hours or whatever?
Osman.
Thank you. Just to put up some challenges we have. Maybe it's related to Africa, but the first problem we have is the district where practitioners are recording the health data are not coincided with climate where we have the data. So completely different. So sometimes to diagnostic a case study is very, very difficult based on that thing. The other challenge is also climate is only one factor that can explain something what's happened. There are too many other factors that can explain it. That's another challenge. But what we are trying to put in the framework of climate services in Senegal is trying to do some kind of diagnostic, coming back each month to meet together and to go back and to look at what's happened and to try to explain it in the time of if climate is a determining factor or not. But this exercise, the most important thing is to try to learn to each other. What come out first is that this term of anomalies that we use, very seldomly, and also the way we record data very systematically in Met services in hours, and we know what we mean by these parameters. Those things are missing. For example, missing data sometimes is a big problem with the health issue. And trying to learn from each other, how do we collect data, was a very big step forward. And also those case studies are very important. Looking one time that you have epidemic something happening, and to look at the climate diagnostic, to look at what parameter was important or not, and try to move forward with it. There is a back and forth communication with the health services. That's where we try to put a bulletin together in health and in climate, and try to diagnose what's happening. And little by little now we are knowing what is the demand, and the health sector is understanding more and more what do we mean by anomalies, what do you mean by this and that, and we are moving forward. I think this dialogue is very important, and also to know that climate is only one factor. You need to factor many other parameters. Thank you.
Thank you. Kumar, can I make a suggestion that we ask for some input from our stakeholder colleagues, since they happen to be here and they've come to provide us some feedback. So we have Sarah from the START Network, group of NGOs, and we also have Roop from the Red Cross Climate Center. So.
Thank you. Yeah, I'm coming from the user side, so I work for a humanitarian network. And I guess I was wondering, do you have spaces, like really intentional spaces where you can come together with the users on a regular basis just to sort of have that dialogue and develop that language? Because we've sort of identified that as a big gap in our network, and we're trying to create these spaces so that we can work together a little bit more intentionally. And my other question was for Melissa, actually. I think you're mentioning there's a bit of a tension between developing the forecast, but then also time required to provide more information to the users. And I was wondering, is there anything that the users can do that would help you to sort of build the case, perhaps for putting more resources into the analysis or information provision side, sort of get more buy-in, say, from your stakeholders? Because there's a real challenge, the forecasts are being made, but then people aren't able to use them or interpret them. It's obviously not ideal. So I was just wondering from the user perspective, is anything that we can do to sort of build that case a bit?
Okay, it works now. First, I just want to take a second to apologize that I think I missed emails and didn't know I was supposed to talk on something specifically up here. So a lot of our problem in Canada stems more from our health partners wanting more information than we can provide. I'll start there. So they're expecting more certainty than we can provide them up front to the forecast. But when we can provide more certainty and more product, they can't necessarily use it either because of resources. So there's that big balance. But what we have done in many cases, and because I work individually with each individual province across the country as we've developed the system, is that I've provided an awful lot of webinar, like online information sessions on how to understand what we're providing and what we're doing and how our process works. And I think that has helped a lot. But I think that the real issue is communication between us and them and trying to determine what exactly we can provide under what terms they want. So we did go through an exercise with the first development in time for the Pan Am Games where I went and we interviewed at least 15 different health authorities in the region asking what specifics do you want, on what timeline, and how do you want, and we sort of went with that for the rest of Canada. And what you mentioned now is a good example of how we probably need to review that for each region, except within Canada we're trying to keep a national standard across the country, and that makes it really difficult in such a large area with different political atmospheres and different requirements. So I think it's really just a dialogue, it's communication, and it's working together and providing more education on what we do provide, but making sure it's user-friendly.
Can you hear me? Okay. Hi, everyone. My name is Roop Singh from the Red Cross Red Crescent Climate Center. And I guess I come from a perspective thinking about Glenn's diagram that he had earlier. I think of myself as sort of falling in the category of being in a boundary organization. So we work with a lot of Red Cross national societies who are sort of implementing, and they're the ones who would potentially take warnings and actually disseminate them to the people who need them. But we also work with sort of forecasting agencies, global producing centers to sort of understand what are the forecasts that are available. So I understand that we have limitations in terms of the data that's available, and our forecasts are in no way perfect. But the things that I'm often looking for are where do we sort of have enough information that we can actually take action, given what we already have, where are the places where we can actually really work together? So I'm wondering from all of you, just thinking about, I know you've all mentioned various challenges and various opportunities, but thinking, say, for the next 5 years, what is sort of the one thing, if you could pick one, that you would say is the biggest sort of opportunity that you can see for making a big difference in getting the information that you're producing to actually be used?
All right, I'll speak about that in terms of what we've done in Canada. So we haven't completed the process. We still have one province and one territory to sort of adopt our new criteria. And, sorry, lost my train of thought. Just remind me for a second what your final point was.
What is the one thing that you see as a big opportunity
Okay.
for using the data and stuff that you already have?
I've totally lost my train of thought.
I
Sorry.
can say that from my perspective, yes. Okay. So what I would like to see is to sit down together with Red Cross at Red Crescent and show them what we have and hear from them what they need and what their requirements are. And from there, we can look into our capabilities and see what we can provide. I think that for not having the dialogue with Red Cross, Red Crescent, or any other user, it's hard for me to imagine what you need. I mean, right now, like I said, you know, I know what my colleagues in the Met services need, and we easily provide that information to them because we're comfortable, because we speak the same language. But I do not know what Red Crescent need and what their requirements are. And I can tell you that if you're talking about heat, to me, it's a low-hanging fruit. There is something we can do about heat. I look at the system, I know that there is some predictability. It's never going to be perfect, but I know temperature being more predictable than precipitation, I would be more confident giving a forecast on indicators for heat than, for instance, you know, flooding that's going to happen in 1 week or 2 or 3 weeks. So if heat is something that Red Crescent is interested in, I would be more than happy to sit down at the table with Red Crescent, and then see how we can move forward into providing the information. Would be more than happy to do so.
Okay, thank you. Final comment from Glenn.
Let the panelist answer Roop's question before you move to more questions.
Okay, cool. Yeah.
So I'll tell you, I remember my train of thought. Okay, so at least within Canada, within our system, I've already talked about the partnership with Health Canada, and I know Julie mentioned yesterday the heat alert response system that Health Canada's developed. And I think that our goal within Canada in particular in the next 5 years is to convince our provincial and territorial partners that they need to develop a heat alert response plan. In some cases, that's been a fairly simple process, especially in the warmer areas where they've already experienced the mortality. But for the areas, especially, for example, in the north that feel that heat is just off to the side and not coming to them, it's not been an easy process. And we're afraid of the situation where, because of the acclimatization, we really do get that heat event and they're not prepared and they're not willing. So it's a lot of an education process in Canada right now because, you know, we think we're in the north and we're cold and that only Toronto, Montreal receive heat, but it's really not the case, and we know that in terms of climate change.
Can I just add to that? I suppose it's important to put everything into a plan and then, like, you know, to identify lead agencies and also other supporting agencies, and then identify their roles and responsibilities. So that once you start from the lead agency, it should, like, you know, activate all the other agencies, because messages coming from different authorities is not going to help the people as well as the other stakeholders. But certainly, partners like, you know, all the NGOs, Red Crescent and all these things, and other stakeholders, identifying the roles and responsibilities, so putting everything into a plan would be very helpful to, like, you know, provide relief for the people.
Okay, and for me, for the next 5 years, I have 2 issues. First is to develop multidisciplinary observatories, where we can have at the same place health information combined with meteorological or climate information. And the second point, when there is some weather alert, the difficulty now is that we need a quasi-real-time access to health data to see if the heat wave, which is occurring now, has a real health impact, and that the information could come to the general direction of health, and some action be taken at a very quick time, especially in the context of heat waves, which occurs on 2, 3, or 4, or 5 days.
Yeah, it's very clear that the point of integrated data and therefore integrated information systems is critical in a lot of our endeavours. Now I'm going to say something potentially provocative and probably rather crude, and it's got to do with money. Money makes the world go round. We've heard various platitudes about let's work together, we can solve these problems. But sooner or later, and this is perhaps where it's naive for me, sooner or later I suspect a contract will have to be signed. And I suspect a lot of the stuff which needs to be done will have to be facilitated by money flowing between a producer and a user, because we live in a kind of a neoliberal world now where everyone has got to pay sooner or later. And I know a lot of agencies do not do stuff for nothing, whereas there's a huge demand from a potential user. So is money a big barrier? And that's, I'm being crude here.
Yeah, the last comment, Cedric.
Just to your last point, very quickly, you can also have multilateral agreements that are in kind in nature rather than monetary, and that works in the Caribbean. I want to echo Osman, and also related to your question, or to your point, it is really an iterative learning process between the partners. We issue every 3 months a health climatic bulletin together with the Caribbean Public Health Agency as well as the Pan American Health Organization. And in that bulletin, we've learned from each other how to speak each other's language, but still include each other's feedback every single time. Now, this has been running for 2 years, and you can see that every bulletin, we get a little bit closer to providing the information that, the public health sector wants, and also that we can provide. And so regardless of how accurate your forecasts are, regardless of how much climatic analysis you've done so far, what they find more important that we can understand is they say, start with your more confident information. Because with your more confident information, we're going to be able to tweak the language as to what are the recommendations in specific parts of the public health sector. For instance, if you're talking about NDCs or if you're talking about vector-borne diseases, we all know that there are some NDCs that are much more dependent on climate than vector-borne diseases. So if you have a very confident piece of climate information that can be that can allow for a very direct recommendation within certain parts of the public health sector that deal with certain NDCs, but that might not be as confident in the recommendation when it comes to people that deal with vector-borne diseases. And then you're talking surveillance, you're talking epidemiology, etc. So what you learn over time is that even as a Met Service person, or in our case, a regional organization, you can find out in the end what it is that your information will be useful for once you have that iterative dialogue. One time does not work. One time is a start, but it does not work. You need to do it continually. And for that, a multilateral letter of agreement can be very important.
Okay. Thank you. Yeah, we are running short of time. Maybe one question, one comment.
Just only one comment. Thanks for bringing up the issue of money. I'm an economist from Chiang Mai University. I used to attend a workshop organized by FAO, and it has to do with aquaculture industry, and they are getting into the issue of insurance and trying to map it with that's attendant from the private industry coming along and trying to work out some form of protection from farmer being exposed to changing climate and all that. I'm very curious about how things are being worked out here on human health, especially in conjunction with any scheme at the national level trying to protect
people from being exposed to changing climate and all that? Has there been an effort of trying to reach out in terms of improving projection of the damage and all that? I'm curious.
Okay, thank you. I think we have a kind of excellent discussion, and I think a number of points have emerged probably which will help us to bring out some recommendations and also some action items. So without extending further, I would like to thank all the panelists for their excellent thought-provoking presentations and also your active participation in the discussion. I give the floor to Hannah for further announcements on the breakout session.
Yeah, just very quickly to say, go on and have some coffee. It's been an intense discussion. But please come back because we have another panel. And I think we are going to try and maximize the time for discussion. Clearly there's lots and lots that everybody wants to bring to the table. So come back 11:30 and we'll start the next panel.
Yes, thanks for meeting me too. Well done, everyone, sticking to us. I think I missed an email somewhere. No, that is all right. I mean,
happens to be the lowest humidity of the day in terms of relative
Welcome back, everybody. Please take your seats near the front. If I can ask you to come up the front, that would be great, because we want to get some discussion going. Great. Okay. So thank you so much for all your contributions to an extremely varied and rich discussion this morning. Can I have your attention, please? Thank you. Thanks very much. We had an extremely broad discussion this morning. In an attempt to summarize, we heard some regional, national, we heard about what's going on at national and regional centers around the world, specific forecasting systems and challenges that are being faced, technically speaking. And then when we went on to the discussion, what I thought would end up being hashing out some of these technical issues that the Met Services are facing actually turned to some of the bigger enabling environment issues. So how do we actually work together with the health sector? The age-old question of that. What about the capacity within the Met Services and within the health and humanitarian sectors to engage? The mandate question, the funding question, these bigger issues also came up. So I suppose just to remind everybody that this is the first GIN forum, and so we're really just trying to figure out where the areas are that we should be focusing on. So in a way, it's not surprising that we don't manage to really hash out all the details within the one morning, but it's very helpful for us to realize what exactly is coming up, what people think are priorities. Okay, we're going to turn to a slightly more forward-looking space now. We have a panel discussion relating to emerging areas of research and the future directions for heat information products and forecasts. So I'm going to welcome my panelists up onto the stage, but I need the agenda. That's okay. Right. Okay. So first we have Mr. Lapshun Li, who's from the Hong Kong Observatory, China. Welcome. Mr. Lapshun Li is working on impact-based forecasting with the WMO. Sarah Klassen, who is with the START network, which is a group of NGOs trying to take action on humanitarian disasters related to climate events. Professor Dr. Atul Kumar Sahai, who is at the Indian Institute of Tropical Meteorology and pioneering the subseasonal forecasting in India. And Professor Shubhayu Saha of the Center of Disease Control in the US. Welcome. We'll have a round of opening statements, much as last time, but I'm going to be much meaner than Kumar. And you have in front of you our student volunteer, Ansi, who is going to remind you when you get to 4 minutes of your 5-minute opening statement, she's going to hold up a sign for you to let you know that you have 1 minute left. I'm not doing this because I don't want to hear what you have to say, but just because I know that there's going to be so many questions and discussion points and we want to get onto that conversation. So without further ado, Mr. Lapshun Li, would you like to start?
Okay, so I'm from the Hong Kong Observatory. I'm now responsible for the operational forecasting office. So first of all, welcome to Hong Kong. Right now it's the winter time, but usually in summer we can get temperature as high as usually 33 or 34 degrees, and it will be even higher if there's a tropical cyclone nearby, because when we're under is the influence of its subsiding air. So in Hong Kong, although we are, our area is not very big, but we have a lot of observations all over Hong Kong, measuring temperature, the humidity and also rainfall and also other weather parameters. And since 2008, because China held the Olympic game in 2008, in Hong Kong, we also had the equestrian game for the horse. So we also installed some what we call the WBGT, wet bulb globe temperature equipment in Hong Kong. At that time, it was for the horse. But right now, we use this equipment also for measuring the temperature, humidity, and also the effect of solar radiation in Hong Kong. Therefore, we developed an index called Hong Kong Heat Index. Basically, it is based on the WBGT, but the formula is a little bit different because we had a study in collaboration with the Chinese University of Hong Kong. We studied some hospitalization data because we know that when it becomes very hot, the number of hospitalization will increase abruptly when certain threshold is met. So based on the study, we developed the Hong Kong Heat Index, which is for the climate of Hong Kong, which is usually rather wet during summertime. So the feeling is not so good in Hong Kong, even though the temperature is only 33 or 34. But because of the humidity, so people will become uncomfortable and has to go to the hospital. And in recent years, we also install a lot of very small sensors for detecting temperature and humidity in the urban area. We install them on the lamppost along the road so that we can collect a very dense distribution of temperature in the urban area. So this is very useful for us to study the effect of urban heat effect. So about forecast, in Hong Kong right now we forecast the weather up to 9 days ahead. But last year we also launched a very special service which extend our forecast up to 2 weeks. And the product is in the presentation of probability. So you can, the public can see how the temperature, how high it can go, but in terms of probability. Regarding warning, we have a very hot weather warning, which will be issued when temperature goes up to 33 degrees. And because recently we developed the Hong Kong Heat Index, so we also issued a warning based on the heat index. We have a two-tier system. When the heat index goes up to a certain threshold, we will issue advisory. And when it is forecast to be even higher, we will issue the very hot warning. So in the future, I think we will have more study with universities. For example, right now we have a study with the Hong Kong University to see how several days continuous heat how it affect the people. Because right now our warning is usually 24 hours ahead. But if we talk about heat wave, which can last for several days, right now in Hong Kong, we still don't have a definition of heat wave. Actually, internationally, there's no standard for heat wave. So first of all, we are trying to first of all define heat wave in Hong Kong. We will try to look at also the hospitalization figures to see how many days of hot days and hot night will start to affect people, especially that they have to be admitted to hospital. Then we will try to develop some kind of alert or warning based on the occurrence of heat wave. Thank you.
Hello, everyone. I'm Sarah Clausen. I'm from the START Network. It's a network of 42 NGOs, which also means I'm not a weather expert. So I'm very much still learning how to navigate this world, and forums like this are really, really helpful with that. So it's great to be here. A few years ago, about 4 years ago, the START Network launched the START Fund, which is a pooled funding mechanism, and it tries to take the media and politics out of aid, and this fund is managed by humanitarians. So we get to decide where we allocate humanitarian funding, purely driven by humanitarian principles. And traditionally we've focused on humanitarian response. But in 2016, we opened the crisis anticipation window, which allows any of our members to access these START funds on the basis of a forecast. And the idea is let's act early, let's switch from being so reactive to more proactive, and let's put projects in place that can mitigate harm and loss. So far we've anticipated a variety of hazards. We've had 29 anticipation alerts. About 2/3 of those receive funding, and heat waves is one of the hazards that we've been responding to. We learned pretty early on that if we want to work with our members, so humanitarians on the ground, to act in an anticipatory way, we really need to support our members with accessing forecasts, with understanding forecasts, and then on the operational side, really understanding what to do. What does an anticipatory project look like? And an example that kind of summarizes all of this is a failed anticipation alert in April 2017 that was raised in Pakistan. And what happened was our members were concerned about heat, and we began these discussions in country, but they raised the alert as the heat wave was spiking. And I think records were reached across the country, and we saw loss of life. And so the alert wasn't activated because decision makers felt that it was too late, which it was. And so from this experience, we started a partnership with the London School of Economics in the UK, and we started a project with them where we asked questions like, what can we learn from this failed alert? Where can the good forecasts be found? There's a lot of confusion in country about this. And when is good forecast information be available? When should we be acting? Is it 1 month in advance? Is it 10 days in advance? And so we produced this product with them, in collaboration with them, which brought clarity to the network. We learned that the most accessible sort of quality forecasts are provided by the Pakistan Meteorological Department. We should be acting around 8 to 10 days in advance. This is where we know there's a level of certainty around the forecasts. And we also helped to clarify our understandings of heat waves. So I think humanitarians, and this might not seem mind-blowing to you, but traditionally you're just concerned about temperature. But of course, as we've been learning, there's so many other factors that we should be thinking about, like humidity, like vulnerability, and there's a lot of confusion around this. And so this product really helped clarify all of these issues. In May 2018, our members used this product to raise an anticipation alert around a forecasted heat wave in Sindh province, and £70,000 was released through the START Fund to put projects in place. We set up 12 heat cooling centers in urban areas that had information and water points. And we also conducted a community sensitization campaign in local languages, trying to use communication mechanisms that our target audience would understand. We've learned a lot through this project. Co-development is really key. It took us about a year working with LSE before we even had a common language, and we want to continue to create spaces where we can come together to have that language. We learned that in order to engage in this space as humanitarians effectively, it's not about having a lot of information, it's about having the right information. We can't act in a timely way when we're bogged down and we're overwhelmed. We also learned just that effective projects, it just takes a lot of time. We want to create spaces, and we do this at the global level, where we bring together forecast information providers and humanitarians, but we want this to happen at the national level, and so that's where we're going moving forward.
Yeah, good morning. Myself, Atul Kumar Sahai from Indian Institute of Tropical Meteorology. And in India, Bangladesh, Pakistan, everywhere actually, our forecast, understanding, everything starts from monsoon. So we started, Government of India started monsoon mission in 2011-12 to forecast sub-seasonal and seasonal monsoon performance. Then when we did some experiments and after some 2-3 years, we were basically catering to agriculture and water sector and these things. And in 2015, in the SOSCOF in Sri Lanka, there was one session on health-related issues, and Dr. Hanna was visiting to IITM, to our institute. And before that, we started just looking at what is the performance in other seasons. Because before that, we were only looking into monsoons. So then we started looking in other seasons. And then Hanna was visiting, and she told that there is a great potential in this issuing this forecast for this region. And so we have not started it in 2015, we started from 2016. But then we started understanding what are the heat waves and how these are generated, because without understanding, we cannot give the forecast and the products. So we found that generally 40 degrees centigrade temperature hovers around this 40 degrees centigrade in March, April, May, June over India, Bangladesh, Pakistan, in these regions. And humidity is very low because monsoon is not there. Monsoon sets in these regions, particularly the heat-prone regions in India, and this by the 15th June, and after that only. Before that, there is no humidity. So then maximum temperature is the only thing which we can see. But there are other things which we have not discussed here, that is in India and even in Bangladesh and mostly in Pakistan also, drinking water is a big problem. And when there is a already drought-like situation prevailing, and then overall on top of this, if there are heat waves are coming, so that makes the situation more vulnerable. So what we think that, and we may propose in this, we have to also look after what is the prevailing drought-like conditions when we are giving forecast in these regions. So generally, we have seen that heat waves are generally defined by station data, but model forecasts are on gridded data, and gridded data, one grid is representing the whole area of that size of grid. So we have to develop some slightly different criteria for gridded data than the station data. And then we have seen that there are different types of processes which are affecting the heat waves in India. So Northwest India, generally heat waves are there from 7 to 15 days, and they are affected by anticyclones and this thing. And then there are regions in southeast, southern east, like Telangana and Orissa and Andhra, in these regions, where heat waves were slightly small, 6 to 10 days. But they are affected mostly by INSO conditions in the Pacific and this. But there are situations when there is a whole heat wave starts from northwest and goes up to southeast through the whole, and then it is 15 to 20 days persisting. So then when we started forecast, already we were having seasonal forecast system, we are having sub-seasonal, and Dr. Bhan has already told about 3 to 5 days. But seasonal forecast is only for the India as a whole country, that the season will be warmer or cooler or this. This has some, means you can say skill, but if you go to a smaller scale, there is no skill in that. But so this will give we will give the policymakers, and this, so they will be ready that, okay, this will be warmer or cooler or what. But then sub-seasonal scale we are giving on sub-regional scales, that is we call sub-divisional scales. And that forecast, those forecasts are very good. Up to 2 weeks, it's very skillful forecast for heat waves, severe heat waves and hot days. And even we have calculated anomaly correlations and SEDI, symmetric extremal dependency indices. So they are up to 70% probability level. They are very good up to 2-week forecast. And in 3 to 4 week forecast also there is some actionable skill is there. So what we are making is, we are making daily evolution of Tmax, Tmean, RH2 meter, and also to represent the drought or flood-like situation or wet or dry conditions, we are also giving SPI, standardized precipitation indices also map for that. And then we are giving weekly averages of 4 weeks, 1, 2, 3, 4 weeks. Also, we are giving histograms of how many days are above the threshold in this region in the next 15 days. So these are the things which we are giving. But I have to say that the dynamical model forecasts are generally in where our system is having cold bias. So, and particularly over the Himalayan region and this, there is very big cold bias in the model. So you should have data, observation data to correct the bias. Otherwise, so anomaly forecast we can give, but actual forecast you have to give by bias correction. So for that we need data in this. And health data also, because now we are giving forecast for dengue, malaria and other things based on their threshold values. But we are not collaborating with them. We are trying, but we have to co-produce these things for other health related things other than health.
Hi everyone, my name is Shubhayush Saha. I'm with the Centers for Disease Control in US. So there's a notion in economics, it says supply creates its own demand. We at CDC, we work with state and local health departments, and as a program, the Climate and Health Program, we began around 2010, 2011, so we've been in existence for about 7 and 8 years. And very soon in the program, we realized that the health departments were an enthusiastic and intelligent set of consumers who wanted to use weather information, climate information, but didn't have the knowledge and the expertise and the capacity to access that information. We worked actively with partners in NOAA and NASA across the federal agencies, and we created a data portal. We essentially got weather data, climate data from various agencies. These were gridded products. We converted them into county-level measures, which made sense from a health department perspective, because that's the level of action and policy making that they function under. And this data portal has been remarkably successful in creating an appetite for using climate information, using weather information across the health communities. As part of that socialization process, I think the health departments were enthused enough and felt empowered enough to have these conversations even locally with these weather forecast offices. There are about 124 weather forecast offices in the US, and at the absence of any federal level action where these heat action plans or early heat warning systems were being implemented and instituted, these were local collaborations which the health departments were working with the weather forecast offices to refine heat alerts that were being traditionally used. So that has been extremely empowering. But as we sort of muddled our way through, refining, establishing, and refining this process, it was bewildering from a health perspective to see the number of different metrics for temperature that were available around. And consumers are impatient. And so we didn't have the ability or even the interest to delve much into which one should be used. Maximum temperature, minimum temperature during the day, during the night, heat index, humidex, synoptic classifications. It was extremely confusing. So we, we looked at mortality data for the US for 1999 to 2009, and we looked at about, I would, probably 90 odd definitions of heat wave, combining intensity, different metrics, different lag structures, the number of consecutive days. We went through that analysis. We published a paper in BAMS, of all places, health folks publishing in BAMS, in 2016. And what we found out was that we did this analysis for 8 US climate regions, and we saw that out of the 8, 6 regions, definitions using daily maximum temperature had the highest sensitivity when we were associating heat wave days to mortality, and there were only 2 places where the daily heat index measure, trumped the other ones. Now, this is essentially to say that, the information that the Met Service provides, it needs to be, simplistic but scientific. And, this was our effort to, somehow inform the Met community that, as far as sensitivity to heat-related mortality. We're looking at all-cause mortality, but this would probably be true for heat-related mortality as well. That these definitions around commonly available metrics on daily maximum temperature and daily maximum heat index are probably good enough. And I say probably because we have to sort of make a distinction between this pursuit for perfection. When you say how accurate are our forecast products, let's say, and there has been quite a bit of discussion on impact-based forecasting. And my thought on that is that the heat actions, the interventions, the actions that health agencies would take based on the information that we get from the Met community are limited. It's not, if you say, tomorrow is going to be, 95 Fahrenheit instead of 90 Fahrenheit, the health actions that would precipitate are probably not dramatically different. And so one could think about, providing, sort of thinking of accuracy of forecasts, not by every temperature difference, but a zone of temperature which is related to certain heat actions that would follow. So in that sense, it generates more confidence in the consumer community and that correct information is being supplied to the health community. And we make it a lot more simplistic so that these scientific products where a lot of effort and a lot of expertise and a lot of intellectual capital is going towards, but the final product is not sort of mired in complicated science, but is somehow useful, keeping in mind what this what the consumers want, in terms of the health actions that would follow based on these forecasts that are produced. Thanks.
Thank you so much. What a great round of opening statements. There's so much to go on there. I'm really sorry to have stopped you because I'm sure you all could have talked for longer and it would have been really great for us to hear what you have to say. But I'm going to open it up to the floor for some questions and we'll see where we go from there. So please raise your hand and we'll bring around some microphones. Kumar, to begin.
Yeah, I'll start with the point raised by Shubhayu. Actually, forecasters typically focus more on the skill of the forecast, so it's more of quantitative skill. And what I think we should try to promote is estimating the value of the forecast, what the forecast actually meant in terms of the benefit that comes out of using that forecast in a specific action. So in that sense, I think if the health sector can provide some innovative way of packaging the forecast information. Actually, there may be a more reliable information that can be generated, which probably the forecasts are not as confident as they see in terms of the forecast scale. I think that interactive process can help in making a better use of the forecast information.
Comment from the floor before we go back to the panel for responses. Cedric.
In line with what you say, Kumar, our experience with the health sector in the Caribbean is that going through several test phases of our health climatic bulletin, you really see a difference between different audiences whether they want more numbers or text, whether they want more figures or maps, whether they just want categoric information, just like you suggested, or whether they wanted this deterministic information. Ultimately, what we settled on is basically by almost democratic vote, basically by the highest value generated, we decided to actually limit the numbers to a minimum, but rather state a statement, a textual statement with high confidence, medium confidence, low confidence. And they're fine with that. We haven't had any objections since then. And that works very well for forecasters, but also for the health sector practitioners, because the health sector practitioners know which ones to trust more. And the Met Services are also happy because that takes into account the inherent uncertainty of their climate information. So you get the benefits from both sides.
from John.
I'm going to offer a UK Met Office perspective from the chief meteorologist commenting in Australia recently about their perception of quality from their customers, where they said when they put out a very good forecast and they let it go and they didn't make much comment, their scores for quality and accuracy went way down. And when they had a tough forecast that was looking a bit odd and they weren't sure of the numbers and they had to talk to the customer a lot to help them to understand the product, the perception was the customer said, your forecasts are wonderful, they're very accurate, they're very useful. It tells us volumes about dialogue and volumes about the problem of sticking a product out the door and letting it go.
Related to this, otherwise I think I'll just let the panel respond and then come to you.
Okay.
Is that okay? Thank you. So I'll let any responses from the panels. Those are mostly comments rather than direct questions, but if you have a comment, Sarah.
There we go. Just to say I totally agree with your comment. As a network about uncertainty, we've been trying to encourage our members when they're following a forecast and raising alert and requesting funding through the START Fund to be transparent about the level of uncertainty linked to that forecast. Decision makers are learning, and we've been doing a lot of capacity building around this to ask, it's not just about having a forecast, it's having that conversation about the level of uncertainty involved. And, as a network, we've got to make a decision. We are a humanitarian network within 24 hours. And we can't be presenting our decision makers with 50 pages worth of data. And so a lot of the direction we want to go is actually learning how to take information off the table, putting in one forecast, but putting a little bit about this so what. We have this forecast. What does this mean to humanitarians? And I think that takes a lot of capacity building, and this is where we're kind of going as a network. I think when we first opened the anticipation window, we were naive, and so we thought that we could get the perfect forecast, and we could be really certain, and we could be great stewards of this humanitarian funding. And I think with time, we've been realizing that stewarding the funding well is actually having open conversations about the uncertainty involved.
In the experience of Hong Kong, we find that for the public, they prefer very simple message, whether you have a warning or whether you don't have a warning, because they prefer the observatory to tell them what to do, what actions they have to do. But in recent years, we are promoting probabilistic forecast, but seems that the public they want simple solutions. So we are now, first of all, we promote the use of probability forecast for government departments or other NGOs or for the decision makers. They are more acceptable to the probabilistic information. So this is our first step. But I think in the future, we have to promote more about the use of probability forecast for also the general public.
Andreas, I have actually one comment leading on from that. So we're hearing that for many different types of stakeholders, particularly those working on the weather timescale. You don't necessarily need to know if you're talking about 75% confidence or 85% confidence. People just want to know if there's a warning or not a warning. Where this gets tricky is when we're going sub-seasonal and seamless prediction area, where the confidence that we have in our predictions is much lower, and actually still we haven't got methods to properly recalibrate the forecast. So you could have a forecast that says 80% probability and really it's more like 50%. We're not quite there yet. So how, Dr. Sahai, how should we think about this type of probabilistic warning if we're starting to issue sub-seasonal forecasts?
So actually we also do not know how it will be really utilized by the user. We define some probability, we give probability forecast, and we also, as a forecaster and forecast generator, we say that this is the skill in this probability level or something like that. But how actually it will be used, we also do not know in that. But we also provide some deterministic forecasting to this. As an ensemble mean, we provide deterministic forecast. And if this deterministic forecast is also skillful up to 2 weeks, then we say that yes, this is the deterministic forecast and this is what is the probabilistic forecast. But actually action has to be taken on 3 to 5 day forecast. Sub-seasonal forecast, you are giving that, because that is based on some synoptic system or something, some large scale system. So that system is moving and that is passing and that is sitting or blocking is there or whatever may be. So that we can say that when it is coming and going. But actually when, and that may be, there may be some displacement in the region. You are saying it should go on 15, it will go on 15 degree longitude, it will go to maybe 16 degree longitude or something like that latitude. That difference may be there. But you are saying that the system is there and there will be a probability that there will be a chance of heat wave. But action will be finally will be taken by 3 to 5 day forecast, and that has to be mostly on the deterministic.
Thank you very much. I would like to address my comments and questions, especially to the non-meteorologists, that means Sarah and Shubayu. I like, Sarah, your comment about, you mentioned about appropriate information. You need appropriate information. And Shubayu mentioned you need something simple but scientifically correct. Can you be more precise in that or more detailed, especially about the temporal and the spatial resolution in that information you demand?
Yeah, no, I mean, good question. I think yesterday one of the participants made this comment that you are the voice of authority, and you are. Our humanitarians want to look to you for quality forecasts. If they're coming out of the network and they're not validated, then our decision makers get uncomfortable because, rightly so, we're not experts in the field. So, for this specific project, LSC did statistical analysis based on the different forecast sources, just kind of finding that sweet spot when we had a level of certainty in the forecast, but when we would have enough lead time to do anticipatory action. And that's where that 8 to 10 days came from. And to be honest, that's all our network is really interested in. We need to know this is where we should be looking and this is the lead time. And so, I can share the document with you because it gives a bit more detail in the analysis that took place. But from our perspective, that's all we need. Heat wave is sort of one of 5 hazards, and we've got a global presence. So we've got the challenge of we're kind of operational everywhere, dealing with all these different hazards. So we just need those 2 things, and that's what LSC is able to provide us with. I'm not sure if that entirely answers your question, but.
So it seems like I'm ending up talking about, talking on behalf of, the state and local health departments that we work with. If you remember, so we saw these epidemiologic risk curves, and there's a zone of temperature over which we see an increase in risk of adverse health outcomes. And so the point is that I don't know what exactly those regions of risk, what would be the accurate characterization or breakdown of those regions of risk, but we can see how the risk varies with levels of temperature, and we can create this graduated system of yellow, orange, red, indicating different levels of risk, and these forecasts could be based on those zones of risk, which then has associated actions and interventions that would follow. In terms of spatial resolution, I mean, of course, more is better, more spatially resolved, but it also depends on sort of the health jurisdiction which is using that information. In the US context, it mostly works at the county scale. Some of these may work at a city scale. And so a lot of that depends on sort of the local political administrative configuration of the region. Temporal ones, again, most of the analysis that we've done, that's the heat epidemiology literature shows that, these impacts are very acute. So it depends on how hot it is today or maybe day before yesterday, which is going to determine the sort of the majority of the health outcomes, the adverse outcomes that we see. So just in terms of temporality, it's probably, that time frame where we need, reasonably accurate estimates of how hot it's going to be. Is that?
So, because of your work with county level, at the county level, and with the health services in the United States, it seems like the county level was the relevant spatial scale. But there could be different scales that are relevant for different types of stakeholders. So there might be a different scale for the START network. There might be a different scale, particularly in different sized countries, right? So in India, obviously, your states are much bigger. So this is sort of gets slightly at this tension that the Met Services are focusing on, which is how tailored do they need to be? And is it the role of the Met Service to do that tailoring to the county level or the city level or whatever? Or should we be investing in boundary organizations? I'm going to call on Rosa now, who was just raising this as a potential thing that maybe we should think about as a community. Do we need boundary organizations whose job it is to focus on this tailoring and also as this go-between between the Met Services and the stakeholders? Would you mind, Rosa, commenting?
Yeah, so partly, so in my organization, I work for the UK Met Office. One of our unique characteristics is that we pretty much are... Can you hear me now? Did everybody get what I said? No, okay. So I was just, so I work for the UK Met Office. And so I was just saying that one of our unique characteristics is that we basically provide seamless forecast or predictions, projections, whatever you want to call it, from very short time scales, which are usually relevant for emergency response, to subseasonal, seasonal, decadal, and up to climate projections, up to 2100. And so what we have is this tug of war with very different users and actually with different sectors as well. And we have very limited also resources. So what we try to do is as efficient as possible in terms of providing simple products, whatever you want to call it. And that could be a data set, could be some sort of tool. It could be just a simple fact sheet about something. And what we found is that we couldn't really be all things to all people. So I hope this makes sense so far, because I'm feeling really jet lag at the moment. It's 4 o'clock in the morning, by the way, for me. So there's a disclaimer for you. And so partly, in the past, our experience as well is that we tended to guess what the users wanted. And so we decided on a certain number of products, and there we go, you use them, you must be crazy if you don't, because it's all there for you. And we found very early on, and I'm going back a few years ago now, very early on that you really needed to have the users on site. And so the way we develop things is that we have what we call the Public Weather Service Customer Group. And basically that involves all the funders. And they set the requirements very early on. But not only that, they also set the evolution of the services. Because you can start with something that is wonderful, but very quickly, perhaps, it becomes outdated. And there has to be a provision in terms of how you keep the information relevant, up to date, and state of the art. And so what I feel we need in many cases is having what I like to call an honest broker, which is somebody basically who facilitates the discussions between the users and the producers. And so we were saying early on, you know, and I think it was you, it's a Ru, who kind of set this thing in terms of what you needed, and the panelists were saying, you know, what the views were. But actually, it seems to me that what we need to have is these conversations on a more regular basis, and I'm quite puzzled as to why we don't. And I think it's because sometimes we don't speak the same language, and it's really difficult to dedicate quality time to establish those relationships and to think about, you know, where the boundaries are. So that was the point that I was making earlier in terms of whether there could be a forum where truly is co-owned by a multiple stakeholder set where these discussions can happen, but ought to be perhaps facilitated by someone who hasn't got as many vested interests perhaps. So I hope that makes any sense.
Julie, and I'll work this way.
So that was a perfect segue into a proposition that I want to make. We've got Cedric in the room who's got a lot of experience with the climate and health outlook. We had Roop ask a question earlier about what can we actually do together. Wasila saying, yes, we need a forum in which to actually engage. We know that it isn't a one-off conversation. So I guess what I'd like to suggest is that as an action from here, we decide that we're going to do a heat bulletin, a heat outlook of some sort. And I know that there's some capacity to do this globally. I think we can do one level, but I'd like to suggest that we also do a regional effort. I'm not sure which region, but with some of the partners here, and we had a chat, I think, you know, Red Cross, I think we can participate. I hope, you know, a little bit of chat with Kumar, but I think something tangible that is specific, that allows us to have this conversation on a regular basis. And we have examples with FuseNet, which I think has been referred to in the Caribbean, which I just mentioned. So I'd like to see if we could have that as an action from here, and it gives us something to work on together to be able to host that, you know, host the dialogue. I'm not sure who pulls it together. It's appropriate for us to at least get it started and make sure that it keeps going. So that's my proposition. And then I guess the second one, it's also very tangible. We have these regional climate outlook forums that happen on a regular basis. We did have one already that focused on heat. And I'd like to ask if it makes sense to try and include heat in many or some of those as a year or two evolves, because they're an existing network of at least the climate people are in one place. So can we start integrating some of the other communities that need to be there?
Any comments on Julie's proposal?
Yeah, not on Julie. What you asked, Dr. Sahai, I'm one of the users of his information. I took how we use the extended range forecast. It's used by intermediate users, not those on the ground. Based on the forecast for, say, week 2 to week 4, the state level secretaries, they assess the level of preparedness. You know, are the hospitals prepared, enough cooling packs are there, ORS provisions are there, their ambulance services are in place. And if action is required to be taken when the heat wave comes, so that they should not be caught offhand. Actual action is taken on a forecast of a scale of 5 days. But preparedness is reviewed before that based on the extended range forecast. That's how it's used in India.
Yeah, this is a short comment on the tailored products that you mentioned. Who should produce actually the tailored info? In my opinion, the tailored products should be co-designed between the providers and the users. And if it involves only input from the weather and climate side, I think it should be produced by the provider on a routine basis based on the co-designed tailored product. But if the tailored product involves additional input from the user side, it should be co-produced. I think that distinction we have to make. It depends on what is the decision context and what type of tailored product that is required. But in general, it is convenient on an operational basis if the producer has this designed, co-designed product, and then they have an assembly line production of this information, it's easy to sustain that process. Otherwise, if you want a kind of a constant interaction on an operational basis, it may not work all the time.
Along the same lines, I just wanted to really second what Kumar has said, and great comment, Julie. However, I think it will take a while for us to get there. Because Glenn talked about the resources, financial resources. The kind of work that we do with InfuseNet involve resources, tailoring, commitment of people's time and all of that. So that's great. But however, like I said before, there are low-hanging fruit. There are things that we can do that may not require additional resources in terms of products. If I look at the recharge that we do for the Office of Foreign Disaster Assistance, where also it's, when a hurricane is approaching an area, they need to know because, they know that countries may be coming to USA requesting assistance, to cope with disasters that might be coming with the next 5 or 6. So we have information that we can put together and they can look at this information and already start planning, knowing that countries might be coming to them. So if Red Crescent or any other organization start, are interested in these things, we can talk about it, and maybe there are things that we can do, and just to start with, and then move forward toward the health early warning system, similar to FuseNet, as you have mentioned. Thank you.
Yeah, Julie, to respond to your 2 questions, yes and yes. But my recommendation would be to start with a spin that is educational rather than operational. So the reason why is that most of us don't have, well, none of us has actually really the kind of tailored seasonal forecast as yet that would be targeting the right actors within the context of a climate outlook forum. So the educational component can come in the bulletin as well, and you really just want to trigger the interest of the different communities at play and involved in a regional climate outlook forum to get traction. That's the role of the ARCOF. If you ask us as a Caribbean climate outlook forum, that's what works. What does not necessarily work the best is to immediately go into an ARCOF with the product that you push as a Met Service or as a region. This is what we're gonna do henceforth. That doesn't really work well. So this education brings about awareness, this awareness brings about interest, the interest brings about collaboration and co-development as Kumar was mentioning. So that would be my spin on it.
Yeah, I'm not sure if I think it makes, from my personal perspective, it makes good sense to start to integrate heat into the ARCOFs. But it's not clear to me that the ARCOF is the right venue for the health folk to be starting to engage, because it's a rather sector-specific event. But I'm going to take 3 more comments, and then I'm going to go back to the panel for some just final thoughts. I'm aware I've neglected you for the last 10 minutes.
Thanks very much. On the question of scale of an understanding of where heat waves are occurring at any time, and I'm thinking about the start issue around all those countries that you're looking at, and you know that getting down to Pakistan's where you need to get to the real data. But how do you decide that you've got a problem coming in Pakistan? If you're looking across all those countries. So to me, there's a question there around a global perspective where at a distance you're looking at, this looks like the region that might go off, And therefore, how do I cascade down to the country of interest? So I just think about an approach that there are very capable weather centres which can do global products, and they can be the beginning of a cascade, notwithstanding that you do need to develop the dialogue to actually get users to use it properly. I don't think one precludes the other if you do it right.
Just picking up on Kuma's comment about co-production, it kind of begs the question in relation to the users and putting some pressure on users to actually understand how their system actually works. And sometimes for a user to totally understand where the risk may arise in their operation requires a risk expert to work with the user, because risk is very, very dynamic. It can happen in different sectors of the particular operation. It can happen at different times of the year. So I think going back to the honest broker thing, we need someone who can actually help the user understand their own risk profile, where the opportunities exist to take advantage of some of the stuff that might naturally flow from a global level system or a more well-defined product.
Thanks. My comment is in the same direction like Glenn. Before that I would like to mention is talking about education is very, very important, but this is part in the heat action plans. It's one of the 8 points that we have. The other point what I would like to comment is when we have forecasts, it doesn't matter how many time, months or seasonal or for the next days, we have to consider that the sector health have too many subsectors. That means we need specific information also for the subsectors. That means the one is for 2 days, we need for the authorities. For Red Cross, maybe we need for preparation of that, we need more for 6 to 5 days and so on. And also for activities outside and so on. We have to consider that.
Okay, thank you so much for all your fantastic comments. I'm going to go back to the panel. We've run over, so I'm going to go back to the panel now and ask if you have any specific responses to these comments or general closing statements you'd like to make. I'm going to ask you please to keep it to 2 minutes absolute maximum because everybody's hungry.
I think besides education, the engagement of the general public is also very important. Right now we are doing many work to involve or to engage the general public in whether not, of course, not forecast, but making observations, and they contribute their observation to our network so that we can have an enriched network of weather observation. So throughout this process, this is also kind of education that can raise the awareness of people about weather, not only temperature, heat, but also other weather phenomena.
There's a lot of points in there, so I've got a lot of thoughts. I'm going to try to get them through. I really like the idea of a more frequent conversation. When we opened the anticipation window, we were meeting as humanitarians and speaking about risks, and we had someone challenge us, and they said, are you talking to the experts? Are they a part of your conversation? And if they aren't, that's a red flag. And I think that challenge goes both ways. I think if you find yourself in a space where you're not engaging with the user on a very frequent basis, it's a red flag. So I want to leave that as a challenge. I think I like this idea of coming together and creating something. I do think there's a need to do a lot of education and capacity building. Something I've noticed with partnerships is they really become valuable when they impact humanitarian operation on the ground. So if it stops just at this common language education piece, I think for our network, we're not satisfied with that. We need something that can really translate to humanitarian impact, and something that we've sort of promised any of our partners is if your information impacts and alerts, we'll provide a case study. We'll give you evidence about how your information helped to save lives on the ground. And so I think from our perspective, that's what we really need to be doing. And finally, I agree with the question of scale. I think what we're doing in the anticipation team is really trying to build the capacity, but we've got all of these humanitarians on the ground kind of monitoring forecasts. We have a group called Forewarn, which brings together forecast information providers, humanitarians, scientists, academics, and that's happening at the global level. But moving forward, we want to translate this. You know, what does this look like in Pakistan? What does this look like in Bangladesh? All of this, you know, way of working, it can't be captured in London. And so that's where we're going to go moving forward. And I want to also just extend the invite, if you are interested in joining a Forewarn at the national level, come and have a conversation with me afterwards.
Actually, in India, there is some coordination between some societies like India Meteorological Society and Indian Medical Association. When we are issuing, IMD is issuing heat wave warnings and other things. But for co-production, there is no mechanism for co-production. And that will happen only if ministries or some top level government officials are also involved, and as proposed by Vasila, that there may be some national subgroup in which meteorological and health officers on government level, they will be there, and then only actionable thing will be done. In India, whatever action is being taken is due to NDMA is very active, and then otherwise in same heat conditions in 2015, more than 2,000 persons have died, and in 2018, only 60 persons have died. 25. And same heat conditions. So NDMA intervention was very, very effective into that. Otherwise, whatever we are giving, IMD is giving forecast, and nobody is taking into account. But when NDMA told, no, you have to take action, then a state disaster management, and they have taken action, and then there is some. So this type of involvement is required.
So just in terms of the co-production issue, in the US context, again, working specifically on heat, the places where there has been a successful dialogue between the health departments and the weather community, the climate community, has been very local, regional initiatives. I think we at the federal government have been successful in sort of creating an enabling environment where sufficient socialization has happened. We at CDC have worked with the state and local health departments to establish these partnerships. Again, these have been local partnerships, and it's been those local and regional dialogues that have ensued once that facilitation happened, which has led to refinements of early warning systems. Health communities, health departments have worked with the local weather forecast officers to say, we are giving you health data for the last 5 years, 10 years. Let's do this analysis together. Let's understand, where we see an increase in risk, and then have that conversation to refine existing systems. So there has been this element of co-production. It has happened locally or at least regionally, but there's definitely been a facilitation aspect to that. Without, let's say, the climate and health program at CDC, this process, this dialogue would have taken a lot longer to happen. So it's been a two-way thing.
Wonderful. Thank you so much, everybody, for a really fantastic discussion. Please go and eat. You've absolutely earned it, and carry on chatting.